Welcome, one and all, to yet another episode of WhickTV. It's the Wicking Hour from 𝕵𝖎. Yes, it is. We're wicking out over here, okay? Thank you for being here. 𝕵𝖎, nice to see you. 𝕾𝖍𝖎𝖙𝖘𝖍𝖔𝖜, satanic culture, maybe. Well, I guess we'll find out as we go. Let's see who else is here. Nerdy Rodent, wow, Fairy Queen, yay, or woo, Fairy Queen, yay. Fairy Queen, yay, indeed. Gang.
Hello.
Today, we are going to be talking about therapy culture. What is it? Why does it matter? Is it something that's a positive or a negative? I don't know. We are going to find out in this week's installment of Ali Explains with special guest Fairy Queen. Okay. So I have had discussions with both of these individuals privately about their thoughts on medicine, therapy, etc. And both of them at various times have brought up this subject of therapy culture. And so I'm just going to give the reins to Fairy Queen here and allow her to tell us a little bit about it, to introduce the topic. So Fairy Queen, please, the ball is in your court. Go ahead.
Thank you, everyone. Hi, everyone. My name is Fairy Queen. You can find me at Fairy Queen's Cottage on YouTube, at Fairy_Queen on Twitter. Me and Wick, we had a conversation about therapy. We had a conversation about the impact of therapy on discourse, both in Twitch poll and outside, even in the real world where people do touch and walk upon the grass. Um, and I had a lot of concerns, and I also wanted to talk to him about a new book that I recently read. And the book that I have read and I'm in the midst of reading is a book called Bad Therapy by Abigail Shrier. It's on the New York Times bestsellers list. It's brand new. It just recently came out, and it criticizes specifically therapy. And the thesis of the book is that despite the fact that there have been increased efforts to improve mental health, increased efforts and increased funding to provide therapy for at lower costs to more people, despite the fact that there has been an increase in the amount of therapy that the average person receives, we still see increasing rates of poor mental health outcomes. And we know that it isn't simply due to a reporting bias because, and we've talked about this, Wick. So those of you, if you've ever heard of Jonathan Haidt, he's a psychologist. I think he's from Harvard University. There is a chart that he put out where he specifically shows that an increased rate of teenage girls specifically like being admitted to hospitals, being hospitalized for increased rates for suicide attempts and for self-harm. And that's a key, and that is key because you can't simply use the excuse in that case that people are simply more likely to report being depressed. It seems to be actually true that people are experiencing like lower rates of mental health based off of that data point because we have more people who are more likely to commit suicide, more people who are likely to attempt suicide, and more people who are likely to self-harm, like in comparison to the distant past. And normally, like when we discuss this, the typical go-to response is, well, the obvious difference between now and between the past is the rise of social media. The rise of yourself. Everyone has a cell phone in their pocket. You have access to the internet. More people are staying inside. Fewer people, exactly. And I have it with me too. Fewer people are actually like the average person of Generation Z is less likely to drive as compared to someone who is a millennial. They are less likely to have they're more likely to get their driver's license at later. They are less likely to have sex. They are more likely to lose their virginity at later ages as opposed to millennials or people from Generation X. We see that there is that's definitely an aspect of this. Challenges that idea. And it challenges that idea for two reasons. One, despite the fact that we have so much conversation about how bad cell phones are, about how deleterious they are for the average teenager's mental health, this public knowledge and public understanding and agreement has not resulted in parents taking their cell phones away from their kids. Like if the majority of people sincerely believed
Mm.
having more access to your cell phone, having increased access to the internet is something that actively might cause your teenager to become more suicidal, to hurt themselves, et cetera, et cetera. It doesn't make sense why parents would therefore choose to continue to provide this access and to provide such unfettered access
Well,
to this if they know that there is this risk.
the
And
excuse
the
me.
second problem,
Okay, go ahead.
oh yeah, the second problem that in the book,
Uh-oh.
and this is something I'm really curious about, is that she says that therapists don't make. Oh, can you not hear me?
You're breaking up. Is
Hello?
it just for me? Allison, is she breaking up for you?
Yeah, there were some cuts in and out just after the pause, but it seems like she's back. Blinking looks like it's happening live,
Okay.
so
I'm okay. It looks like it's happening live. Okay.
yeah, like I
If you
can
need me to
for
hop
a
in
second
and
you were
out, I
freezing,
can
but it looks like you're not anymore.
certainly.
Uh-oh.
But you can hear me now. Yes.
Okay, the audience says
Oh
you're
dear.
good. The
Okay.
audience says you're good, so keep
Here.
going.
Okay.
Okay. So the second issue is that according to like this book, despite the fact that there is this public understanding and we talk constantly about how bad cell phones are for students and are bad for kids and the fact that they can contribute to lower rates of to poor mental health outcomes. Um it doesn't seem to be the case that there is this campaign from therapists or from experts in mental health to tell parents to take these kids' cell phones away from them. In fact, like according to Abigail Schreier, and we can contest this, and I'm not sure if I believe this, she says that in some cases there are therapists who even encourage and who will even give advice to parents on how to continue to have access to social media and how to have access to cell phones and to have unfettered access to the internet. And again, this is specifically to teenagers. Like she's not saying that that these therapists are saying this specifically for children for so under the age of 10. But what she's saying is for teenagers specifically, um, if it was true that like this huge crisis that we're seeing in mental health is as a consequence of cell phones and internet access, then why hasn't there been this campaign from mental health experts to tell parents to remove access from their cell phones? Like why hasn't that happened yet? So and the other issue too is that she also says this, you can't simply blame it off of cell phones because even though there's a precipitous increase like today, we have been seeing a slow and steady rise in like poor rates of mental health like prior to when people had access to the internet, prior to when people had access to cell phones. So she like traces this back to post 1950. No one in 1950 had Facebook. No one in 1960 had Instagram. No one in 1970 had a personal computer, and no one in the 80s had a personal computer where they were live streaming and talking to a huge audience about mental health. This culture did not exist. Like the culture that you and I and that we are all existing in was simply not there during these important decades. And yet, according again to like what Abigail Schreier has said, that rates of like poor mental health outcomes, increased rates of suicidality, increased rates of depression, increased rates of plenty of poor mental health outcomes have been slowly rising since the post 1950s. And that
Okay.
means that I don't think you can simply boil it down to technology bad, technology bogus. So she claims specifically in this book the it's what is it called? It's called the treatment prevalence paradox, which is that if you provide more access to treatment, problem should desist. So if you have more access to mental health, and we have had more access to therapy, therapy has
Can I
been
pipe in real quick?
provided and it has been encouraged to more people than ever before. Yeah,
Real quick, she specifically, like, the treatment prevalent paradox, she says every area of medicine, every other area of medicine, more antibiotics, less people are dying of infection. More ways to fight malignant tumors, less people are dying of cancer. More psychiatric care, we are seeing more people. It's just an interesting deviation from the norm.
But yeah, finish up. But I have
yes,
a lot to say to you, Fairy Queen, as we go. Some questions and things like
yeah,
that. But finish up, and I'll get to it. We'll get to the
yeah,
meat of the discussion. Go ahead.
right. Right. And just to be clear, I'm just representing like so far like what Abigail Schreier is saying. There I have some questions myself, but this is like what the book is claiming. The book is claiming that it's in fact increased access to therapy and the normalization of therapy, which has, according to Schreier, this is Schreier's claim, has resulted in poor mental health outcomes. That in fact, like normalizing therapy and insisting that most people or like that anyone can benefit from going to therapy has actually caused a mental health crisis in this country in the
Mm,
West is like what Abigail Schreier is claiming.
got
We
you.
can discuss whether that's true or not, but that's the claim. Yeah.
Yeah, I think that well, there's a lot to unpack here, right? It was a very thorough explanation, I guess, of the, for lack of a better word, the thesis here that the prevalence of mental health and the way that we deal with mental health is not helping, but instead, in fact, might be hurting us. And I have mixed opinions on that, and let me tell you why. So first of all, I think that she or you or she, whoever's opinion this was, right, is downplaying the effect of technology and social media. Surely, I would agree that is not the entire right reason. It is not the sole reason we are having these things. However, I think that to say that it isn't a major contributing factor is simply false. Like the reason that parents
She
don't
does
take
she does say it's a major contributing factor.
Okay, again, fair enough. But the reason, like, you
Does
don't
yeah.
see parents take their phone away from their kids or try to have them less is because that, unfortunately, right, they also provide huge benefits to people who have them. And a lot of parents will outweigh, will think that the pros, in this case, outweigh the cons. But that doesn't mean the cons don't exist. So I guess my question would be in that case is that according to Schreier or according to you individuals here, uh isn't going to therapy a good thing though? Like I guess that like I've been to therapy before. When I was in the military, they provided access to therapy therapists. First time I ever went. Well, second time technically. First time I ever went under my own volition, okay, to therapy was during my time in the military. Um, it was an interesting experience. It helped me. I don't feel like I was more unwell. I don't feel like it did me dirty. So what's the problem here with more access? I don't
You are an
understand.
adult. You are an adult. And the argument is that it's different for
Yeah.
children and teenagers who are more likely to view the therapist as like unquestioningly an authority figure. There's just a different power dynamic. Like I've had therapists too, and I've had therapists give me advice that I thought was like bad advice. And as an adult, it's honestly not generally, I mean, sometimes when you're more vulnerable it can be, but maybe I'm just like a confrontational person. Okay, I don't have a problem saying, I think that's a bad idea. I think that's a kind of overreaction to this. I
Mhm.
think that's an unproductive way for me to look at this. It's like easier when you're an adult to like just engage in that kind of negotiation that you don't even know that you're doing. But when you're a teenager, when you're a child, you've already had an adult that you regard as an authority figure tell you there's something wrong with you. And frankly, it's above my pay grade. You need to speak to a mental health professional. You're inserting this like power dynamic. It's just not immediately comparable to adults going into therapy, much less like men in the military who are being confronted with like really, really, really intense stuff. We wouldn't expect the normal like junior high student to need to be able to cope with.
I suppose, though, again, I remember being a kid, the fact that there was an authority figure, it was a coin flip whether that made me more or less likely to listen to that authority figure. I'm going to be real with you, right? Teenage rebellion is a cliche for a reason. Um, so I guess, though, can we be more succinct in this? Can we be more targeted? Um, in a nutshell, in like a sentence, what is therapy culture?
Well, okay, to me, therapy culture, it refers to like it's kind of a different thing that hasn't been mentioned yet, but it's sort of like a cultural phenomenon of these like psychological terms, these jargony like vocabs words that are specific to a field, like bleeding into other areas of the culture, higher education, business, public schools, you know what I mean? Like it's that seepage from psychology and psychiatry where frankly some of these concepts are already hotly debated. They are not well settled. And it's just bleeding through. And people that haven't even studied it are trying to apply it to people. And that to me is therapy culture.
That
It is,
sounds
it is,
narcissistic of you. Okay. I can see elements of, post hypnotic stress disorder. Take it. No, I'm kidding, but I understand your point here.
yeah.
Um,
And from what I understand, there at least in 2003, which is a long time ago, and probably the problem's gotten even worse. In 2003, there was a British sociologist whose last name is Ferretti, and he wrote a book called Therapy Culture. And he asserted that he could empirically demonstrate that certain terms that were like previously exclusively within psychology were being used in more law journals, non psychology journals. He could just empirically demonstrate that people that weren't psychiatrists, weren't psychologists, were using these terms more.
is
And
that
that
bad
was
though?
20 years ago.
Is that bad? So $5 from Testicle Johnson to say I went to therapy once and when I left I was gay. Goddamn liberals. Thank you for the $5. Congratulations on being gay. But I guess so yeah, I get more people are aware of these terms, more people are using these terms. Okay, right? Like don't we want that? Don't we want more awareness around these kinds of terminology and things that happen? Don't we want people to be more aware of potential warning signs? So, for example, I'll give you an example. Um, my uncle a few years ago had a stroke. Okay. And the reason that the people around him were able to know he was having a stroke and get him the help he needed so that, again, he made a full recovery. He's good now. He's fine. Don't worry about it. Um, but the reason they were able to get him the treatment is because they were able to recognize the signs of a stroke, right? They were able to see what was going on, identify it properly, and take proper action. When we talk about spreading awareness of the terminology for mental health issues, is that not something that is similar that we can identify, oh, this seems to be what is happening, and then take proper care, either to remove ourselves from that person's sphere of influence if we have no influence over them, right? Like just so we don't get hurt, or to maybe help them get the care they need.
Mhm. So I agree and I disagree. So I would agree with you that like if you're using the terms and like the information to simply observe warning signs, to notice that someone seems to be exhibiting certain signs to keep yourself safe, and if you are well educated enough to understand what the signs are, then yes, right? And I think it's good to have for people to understand, like, we can see the impact of this, like on like spanking, for instance. Like rates of spanking have gone considerably down. Rates of teen violence have gone considerably down. Rates of overall like violent crime have dropped precipitously.
Spanking down,
We
mental health
see
troubles
like
up.
clearly
I
like
see
it's
the connection. Okay. But go on.
I would agree with you that like it is good for more people to be able to point out like what abuse looks like, for more people to be able to identify like, behaviors that seem to be dangerous or unhealthy. Like I get you, like I'm there with you. But there are a couple of problems. One of them is the flattening of terms. And we've talked about that a couple of times like in this space, especially with the word abuse. So even though this terminology has become more normalized to discuss, it becomes pretty clear, like when you sit down with some people and you ask them about the terms that they use, that they don't truly understand what they mean. And I'll give you an example of this. So on the Whatever podcast that happened just a couple of days ago, Julie was on that podcast, and which is why I watched. And while she was on the podcast, someone brought up bipolar disorder, and Brian, who is the host of the show, he said, isn't bipolar disorder, isn't that a cluster B personality disorder? And the reason why he asked this question, and you can watch the video, you can see the clip of like where this happened. The purpose of him saying that was not to better identify the signs. It wasn't to identify if somebody had bipolar disorder or if somebody had borderline personality disorder. He was effectively using these terms as a way to degrade and to humiliate this woman who was on the podcast. It was a way for him to say that because I think that you have this disorder, that this represents the sum total of who you are as a human being. And that's actually like how these terms are actually used. Like when people use words, especially like with cluster B personality disorders, they don't, typically speaking, when somebody is talking about like a disorder like borderline personality disorder or narcissistic personality disorder or ASPD, they typically aren't doing it because they're actually looking for the signs. They're doing it because they want to vilify and demonize the person that has this disorder and to say that you are dangerous, that you are evil. And that's actually like how like these definitions and how these terms are being used. They're not, I don't think like for many people they're actually being used to generate better, mature understanding of like what it is to have like these disorders or to have these mental illnesses or to develop empathy or to help people that are suffering with this. It's more about trying to castigate a group of people as being awful, as being strange, without knowing anything about who they are personally, about their experiences are, or who they are personally, or what they've actually done. It's more about reducing them to a jumble from the alphabet.
I get that. I understand that, but at the same, I didn't do it. It wasn't me.
Y'all see my hands? I didn't do anything.
Wasn't me. Well, she was breaking up. It was having internet troubles. Hopefully, she'll be back soon. Yeah, I had a rejoinder. I want to get the rejoinder, right? Oh, she's been hanging around Sunday too long and she ran. God damn it. Okay. God damn it.
I want to say something.
Please.
So, okay. I did a show with Wick where we talked about the quote unquote uwuification of mental illness. And I talked a lot about a book that I had read called Insane Consequences. The subtitle is to the effect of like how America's mental health industry fails to seriously mentally ill. And it kind of, that whole book is talking about how the quote unquote worried well of America are getting a lot more treatment than actually the seriously mentally ill people who are like rotting on the streets and open air asylums in US cities, and the ACLU is fucking fighting for their right to do that without seeing a psychiatrist. Okay. So, and that is kind of, I mean, there's a paper called The Paradox of US Psychopharmacology, and it talks about, this is really interesting. Seems like there's a lot more medication prescribed nowadays for, mild anxiety, mild depression, non-life threatening, persons not in and out of the psych ward trying to kill themselves type depression. A lot more meds prescribed for that. But the meds prescribed for people with psychotic disorders, it's actually declining since we deinstitutionalized like seriously mentally ill people. And I think this seeping of like psychiatric language into the mainstream, I think a similar thing is happening. It's not helping the most seriously mentally ill people. You don't need a like fancy lexicon of words to identify serious mental illness. Like you can see that shit. You know what I mean? Wick, from what we talked about this. You
We
have a
did.
relative. Like you don't have to know shit about psychology
It's
to see when
very
a
clear.
seriously
Yes.
mental. Yes, exactly. So I think what it's doing is it's convincing people maybe who wouldn't have previously considered themselves to be damaged to view themselves as like unwell in some way.
I I'm torn on this. I understand, right? I understand that there's a huge problem with how people treat mental illness in this country. But the idea that spreading awareness of a thing, a real thing, that people go through, people are suffering from, is going to be a hindrance is hard to swallow. Like, what is the I don't know if the explanation, because I think you're identifying a real problem. It's a real thing that's happening, is that you have more and more the worried well, as you call them, it's a great term, go to seek out therapy when they don't actually need therapy. That's true, but I don't know if the cause of that is the increase in awareness and the increase in lexicon. I would again, right, to counteract Schreier's point here, I would again put the majority of the fault not on the lexicon and the terminology used and how more people are aware of it and access to therapy is greater. I would put it on two things: fandoms around mental illness, and I'll explain what I mean. But like, there are people who make it their whole ass personality to have autism, okay?
They call that reframing your distress as an organizing principle. That's what they call that. That's a real thing that people do.
Okay, and the second thing, right, is there is an increase of, I don't know if I'd say, yeah, I'll just say causal factors that are coming from outside, right, that are increasing rates of anxiety,
Fairy Queen's
stress,
backstage.
etc. Okay. Fairy Queen, welcome back.
Hey, sorry about that. I think there must
okay.
be something strange going on with my
Hmm.
internet. I do apologize. Like,
It's
I think that
fine.
might explain the flickering earlier.
We
But
thought
I'm
you had
back.
just been hanging around President Sunday too long, and suddenly, like, you took up
Oh,
his took up
a
his
run
habit.
day?
Yes,
Okay. Oh, I see.
it's okay.
Well, I apologize. I don't know like where you guys were at, so I don't want to go back into my spiel if you
No, it's
guys were in the
fine.
middle of
Well, I'm doing my spiel now, so you can pick up
Okay.
as we go. So,
Okay.
yeah. Camera, if you got it, by the way.
Y-
But
yeah.
okay. Where was I? Let me remember. Oh yes. So yes,
Fandoms.
we're fandoms of mental illness. I would say those are the two more major causal factors. Not so much that the lexicon and awareness of these terminology has increased. I don't think that's the reason. I would point to the reason being, again, fandoms around mental illness, and as well as an increase in the inputs that lead to mental people feeling less mentally well, such as stress, anxiety, etc. I think that isn't, again, I hate to say it, but it's almost all the result of social media and fandoms around that. So, fandoms around mental illness. Let me explain what I mean, okay? Again, I said this before, but I'll repeat it for your benefit, Fairy Queen, is that there are people who will take their mental illness and make it their whole personality, right? They will say, they will, their whole ass personality is being autistic or something, right? That is all they are, and that is how they identify. And they have a large group of people who will tell them not only is that okay to do, but that is good to do. You should do that. They have whole communities that are based around that, and they build their social structure around having this mental tick or illness or whatever you want to call it. And it makes it, how would you ever get better if all of your friends are based on the fact that you have autism or you have a mental issue, right? Or you have severe depression, whatever. If all of your friends, if your whole social structure is built around that, or a majority of it is built around that, why would you ever get better? There's no incentive to get better. I don't know. That's my thoughts. You guys can jump in. Go ahead.
So I don't disagree with you. I think that that is a problem, especially with mental health. The fact that there are people who will use being autistic, or will use the term neurodivergent, or will say that they use that they have ADHD, or fill in the blank, whatever it is, as their entire personality. Like, I don't disagree with you, but the question becomes, why is that? And I think that, like, and I don't disagree with you that, like, you can lay this, like,
Have you
a
seen
huge
Reddit?
chunk of
Yeah,
this at the
like
feet of social media and internet access, but it's not simply because of that. I don't think that's because of, for a couple of reasons. Like, one of them is, like, w- why do kids specifically grow up with this, like, understanding of themselves? Is it just because they have access to TikTok? And if that was truly the case, and again, I will go back to, like, what I stated earlier, which is that if it's the case that social media and access to smartphones is this deleterious, that it is causing this much of a spike in suicide attempts, in self-harm, etc., then where is this campaign from the APA, or from, like, where is this campaign from mental health experts to tell parents to reduce access to social media? Do they do that? Is that what they say? I haven't, because I haven't seen that. What Schreier claims is that, and this is a direct quote from the book, that mental health experts actually rush in the opposite direction, embracing smartphone use, dismissing smartphones' impact on adolescent depression is as exaggerated, and offer seminars to teens and their parents on responsible social media use. Like, if that
psychologists and psychoanalysts don't get paid more for curing you and reducing their patient base. They don't get more money for that. Okay? Why is there not a reason for the people who benefit from people having mental illness financially to reduce the causes of mental illness? I wonder. Right? Like,
well, that's
that's a good question. Why would they
that's a
ever?
I mean, that's a criticism that, like, Schreier certainly makes. I don't know that I share completely the same opinion, but that's what she says. Like, that's something that she claims in the book. Here's something else I would say to you too, right? So it is certainly true that, like, social media is a
Not
huge
to interrupt,
contributing
Brittany
factor.
Simon, thank you for the raid. Welcome in. We're talking about therapy culture. Actually, Brittany, if you're available and you want to come jump and talk to us about therapy culture, I'm okay with it. You'd be welcome. Just jump backstage. But go on, please. Very good.
Yeah. The other aspect that she talks about, though, which is, again, which I stated earlier regarding social media, is that youth mental health has been in decline for the last 5 or 6 decades. This is not just something that happened, this is not just something that happened, like, in 2012, like, to now.
But
This is not just something that happened, like, in 2000 to 2010. This is something that has been slowly on the decline, that has been on the decline since roughly the 50s or 60s.
slowly. You're right. You're correct that there has been a slow decline, right? As mass media has increased, right? I would, because it's, again, we have mass media in the form of television coming around at that time, getting normalized. We have mass. Oh, Allison has to go.
I can still hear you. I
Okay,
can still
great.
hear everybody.
Like, I understand, but you also cannot compare the spike since what, 2010, 2012? Or something like that. The spike, like, the rate was always going up or whatever, but now it's just it's almost through the roof. You've seen this Jonathan Haidt's chart.
Yes, I know the chart that you're referring to. And the thing is, like, and she would say this, and I would certainly agree with you, that social media is a contributing factor, but it is the mechanism by which this is happening. I don't think that you can fully only lay it at the feet of social media. It also has to do with, like, why are these messages being transmitted to youth in the first place? Why are the youth connecting with this message in particular? And why more so now than at any other decade before in the past? Like, and we can't, and again, I think that, like, I mean, I don't think it's merely because of social media, because of the fact, as you stated, that, like, it has been on the decline since the 50s and 60s. And you're saying it's because of television, it's because of increased access to social media. Well, but if that's true, I mean, why not the 30s then? The 30s was an explosion in radio, okay? There was an explosion of mass media. There was
Also, the Great
movies,
Depression, like,
the Great
legit
Depression.
reasons to want to be really fucking
Well,
sad.
that's something else that,
I
like, she
think,
mentions in the book, which is that if you look at great crises that have happened, like, throughout history, we
Adults
don't
did
see a
kill
rash of
themselves more,
suicide.
but teenagers didn't during the Great Depression. So
Yes.
there were more adult suicides, and that's like all throughout time. Crazy events will happen. And yeah, more adults will kill themselves, but the teenagers and the children seem more resilient until recently. Seems like we're producing much more
Well,
fragile
what
children and
happened,
teenagers.
let's look at what happened in the 20s and 30s with the explosion of radio, right? And not just in America, but throughout the world. World tensions rose like to astronomical heights, right? And we had, I don't know, a famous war during that time too, right? So they had other outlets that they used. Um, to, like,
What do you
I
mean?
get what you're saying. I do. And I agree with what you're saying in that it's not the totality of the cause. It's not all of it. But I
Mhm.
would say it's 80%. It's a huge freaking chunk.
It might be, but we spend so much time talking about social media and how evil it is till we're blue in the face. And that doesn't seem to be and this is my critique, this is not
Mm.
Schreier's, which is that we have lots of conversations about therapy, but all of the talk that we have, like, about therapy and about improved mental health doesn't seem to actually result in praxis. It doesn't actually seem to be resulting in people, like, becoming mentally better, which is which actually, to be fair, is the observation that, like, Abigail Schreier has made, which is that increased access to therapy does not seem to be working. It does not seem to actually seem to be reducing or ameliorating these problems that people are having. And so, like, how good is it about talking about, like, like, mental health and, like, being, like, mentally healthy, like, if it doesn't actually produce any results? It doesn't seem to be.
Okay.
Go ahead.
So, um, I'm going to talk a little bit about a personal experience I have, but the point is what I consider to be the most effective therapy that I've ever had is the exact type of therapy that therapists are the least incentivized to give out. Okay. So, most effective therapy I've ever had. I was like freshly diagnosed with bipolar disorder, okay, manic and psychotic, and making the decision to not take lithium for organ damage reasons and birth defect reasons, and instead take mood stabilizers and atypical antipsychotics, which are like neuroleptic tranquilizers and anti-epileptic drugs. Okay, and I don't have epilepsy, so like I'm doing like an experimental psychiatric thing. They're telling me like lithium will get you better in 2 to 3 weeks, but organ damage long term, and it's like super addictive. And like these other pills, we don't really know. It's going to take months if they work, and like you might be on a carousel of meds
Now,
for a
just
while.
to be clear to my audience, none of us are therapists, I don't
No,
believe. So just
no,
No.
we're
I'm
talking
the
about our
fucking
experiences. I just want to make
yes.
that clear to my audience. We're talking about our experiences. Please don't view this as mental health
No.
advice. We're
No.
just
Yeah, no, this is
talking,
literally a
okay?
random person, okay? Don't
Carry on.
fucking take anything that I'd say, okay? Like literally, I'm just a random person
Yeah.
talking. Um, but okay, so I was like, basically, I say I was very, very mentally ill. Okay, I was like, I probably could have been admitted to like an inpatient facility. I probably met criteria, but those can be pretty rough, okay? And you kind of want to avoid those if you can. And so I was somebody that was like kind of like fucking difficult to be around and like high stress. And best therapist I ever had was a therapist that my psychiatrist to take me on. She said, "You have to see this woman until you graduate from her." From the very beginning, it was known that I was going to graduate from this therapist, i.e., leave the therapist when I got better enough.
Yep.
Her whole purpose was psychoeducation, IDing the signs of bipolar disorder. When do you need to call a doctor and get your meds adjusted? When do you need to consider doing voluntary inpatient therapy? This is how you don't overly identify with the diagnosis. It's just a thing you have to deal with. It's not you. You're not a bipolar
Mhm.
person, right? You're a person has diagnosed with bipolar disorder,
Yeah.
and you can manage that, and you can like it should be the least interesting thing about you that you have a fucking psychiatric diagnosis, okay? So like I was with that therapist for 7 months, and at the end she was like, "Thank you so much. Like I really think I've maxed you out. I really think you are like generally fine. You look like a completely different person from when I saw you, and you look like you could be fucking homeless. Okay, good job. Have fun. And then I went on to graduate from college, and I went to law school, and like, but that type of therapy, getting a seriously fucking mentally ill person, and knowing that you plan to get rid of them and have them stop paying you regularly. Why would a therapist want to do that when you can sit and talk to a person who's like barely anxious for years?
Mhm.
Why would you want to have head cases, basket cases that are going to leave and stop paying you? It's like the most effective therapy is the type that it's the most draining. The clients are the least likely to be financially stable because they're seriously mentally ill. Okay? They're the least likely to have solid health insurance. The type of therapy that is the most actually needed, it is just the incentive structure is all wrong.
Mhm.
I wonder, right? Because this is something you said a couple times, and I'm curious what Fairy Queen would say to this, right? Is the so one of the statistics that Allison mentioned when you had your kerfuffle with the internet was how uh the production of things like anti-anxiety meds and things like that has
Mhm.
gone super through the roof,
Mhm.
whereas production of medication for serious mental illnesses, right, like psychosis, etc., has dropped drastically. How
Mhm.
what to what extent would you say that therapy culture is responsible for that, if at all?
I honestly don't know. I can give you a guess,
Sure,
but I
sure,
don't
sure.
know for sure. So my guess would be that because it's become more normalized to go to therapy, and because it's become more normalized to not just to have a diagnosis, because that's not what I mean. I think it's actually good that, like, for I think it's good that, like, for people that who legitimately have bipolar disorder or who have BPD or have these things, that it is destigmatized, and it's destigmatized so that people are able to exist in society without being called a bucket of names. But we also have to embrace the fact that, like, so it's more normal to meet somebody, like, with a diagnosis, at least in these spaces, and even not in these spaces, like, outside of these doors today, than it would have been, like, 15 years ago. It is not normal to have an anxiety disorder. It is not normal to be struggling with depression. According to this book, approximately 40% of, like, Generation Z has gone to therapy. That is a statistic that, like, was brought up, like, within this book. That's wild. That's a huge amount of people. Not this many people should be going to therapy, which is another key point
Why
that, like,
not? Why not?
well,
Because you also
I'll tell you why,
pointed,
because it's not
if I may
because
finish like asking the question, right? And I'll let you respond. Don't worry. But like you also cited statistics where the rate of mental problems, especially among young girls, are skyrocketing. They're rising.
mhm,
So
yeah.
why would it be outside of the realm of acceptability, or why? It seems expected to me that if you have more mental problems with the youth, that more
Mhm.
youth go to therapy. That it seems to track 1 to 1. What's the issue here?
The issue is, like, first of all, if we're talking about, so this is something that she brings up in the book, which is called iatrogenesis. And it's essentially the idea that, like, the healer harms, that the therapy, that the medicine that you are given is actually something that hurts you, that, like, negatively impacts your mental health. Oh,
It's not unique to psychiatry. Classic example is a MRSA infection after a surgery. Okay, it's just an unexpected, it's a negative effect of a treatment.
mhm. So what that means is, like, if you are somebody who is actually suicidal, so if you're somebody that, like, who has a serious mental health problem, like, you have to go to therapy or a huge negative consequence will happen. You might hurt yourself, you might hurt someone around you, you are extreme, like, if something like that, then yes, you need to go to therapy. But if you are going through one of life's normal, like, trials, so you flunked a math test, your boyfriend dumped you, uh something like normal but negative. Like, if for you to go to therapy and to receive intense therapy might actually worsen the problem as opposed to making it better. There are some people for whom, like, the type of therapy that is offered for is actually something that hurts. So one example might be that she gives in the book, which is that going to a group therapy
Can
session
you
for
remind
grief.
people which book you're quoting from, by the way?
Yes, it's Bad Therapy by Abigail Schreier.
Okay.
That's the book that I'm referencing.
Carry on.
So, one example that she gives, like, in the book is that, like, there are some people that when they go to a group therapy session for grief, they actually become sadder. They actually become more depressed because instead of moving on and, like, trying to be resilient with their pain, they're instead sitting in a group of people with a ton of other sad people and becoming more and more sad. Like, it causes them to ruminate and to dwell upon their sadness as opposed to moving on from it. So that's a potential negative of therapy if you don't need it, right? For some people, they need to go to group therapy. For some people, it is what you need to do. But for some people, you shouldn't go because it encourages you. For some people, it encourages you to ruminate. It encourages
Sure.
you to dwell upon your sadness. That's a potential problem. Another potential problem, specifically for children, which is what Allie was referencing earlier, is that it robs you. It suggests that you do not have agency over yourself. So we talk sometimes, like, about an internal versus an external locus of control. Have you guys talked about that? Yeah.
all the time.
So
But go on.
yeah, but like one of the impacts of like going to therapy and being encouraged, like you have to go to therapy, therapy will help you, is that it encourages you to view your life from an external locus of control. That the events that happen to you are not things that you can control. You are not empowered to make your own decisions. You're not empowered to get through this. You can't do this by yourself. You have to go to talk to a clinically trained, licensed mental health professional to give you the seal of approval before you go on and you make a personal decision for yourself. That that specifically is bad. It's bad for mental health because it disempowers you as the individual in addressing like negative like events that happen within your own life. It's bad specifically for children if they go to therapy and they don't need it. It's because it encourages them to view their life and the control over their own lives is not something that they can take ownership and can do themselves, but rather is something that they have to listen to an authority figure to give them approval for before they can make a decision. And that I think is and that is a negative out and that's another negative outcome that I do agree with like Schreier on.
So, well, first of all, Allison, I want to give you room if you have thoughts, but I have some thoughts here too. So,
The basic idea is that, like, if therapy is potent enough to heal, then it is powerful enough to harm. And we've seen that it is, in fact, powerful enough to harm because just in the 90s, there was this thing called the repressed memory epidemic, okay, where a bunch of psychiatrists literally got people convicted and convictions were later overturned based on like false, like quasi spiritual ideas about like the body repressing memories and hiding trauma that then comes out. And I mean, this stuff is basically Freudian. And also, by the way, there is an extremely popular book. And I say extremely popular, like Abigail Schreier notes that this book has sat on top of the, not the top, but like on the New York Times bestseller list for like 200 weeks, just not moving, just not moving. I've had multiple people recommend this book to me as if it saved their fucking life. It's called The Body Keeps the Score. And it's about how your body remembers trauma and that just comes out sometimes. And it's basically it's the same idea as like repressed memory. The guy 𝕵𝖎𝖎 actually participated in the repressed memory epidemic, and he's never disavowed the theories. By the way, thank you. He has never said, "Oh, sorry guys, sorry." I mean, he believes in it. He believes in it still. You know what I mean? And that guy is regarded as like, oh, you know, I mean, like people will talk about the body keeps the score like it's the fucking Bible. You know, it's crazy, and it like might be complete bullshit. And so the idea that everybody can benefit from therapy, that you know, you might not feel like you have anything wrong with you, but fuck, self-exploration, self-actualization, what could go wrong? It's like going to a surgeon and having him cut you open to make sure that everything looks okay. It's like you're
Mm.
inviting needless risk.
but that
Why?
doesn't seem like a problem with therapy. It seems like a problem with therapists. Like, I
Well,
understand that surgery, like, if my appendix like bursts, I need I need surgery, right? A surgeon could fuck it up and make it worse, right? Or they could save my life. And that's not a problem with medical culture or surgery culture or anything like that. Like, it's good that I'm aware of these things. And even if I just think I might have my appendix bursting, I should probably go check, right? So
What's the
again,
risk if your appendix bursts, you die? What's the risk if you think that your breakup maybe needs a therapist, but maybe you can get through it on your own, but then maybe you go see the therapist anyway, and the therapist just happens to like secretly, stealthily believe some like really popular ideas in therapy that were disproven in the 90s and have like stealthily stayed popular. It's like you're talking about different calculations.
mhm.
$5
And
from Origin of Logos to say this. So, this is an argument that people should possibly avoid going to therapy because of one writer's confirmation bias.
no, it's not just one writer's confirmation. If you read the book, she cites multiple psychiatrists and multiple psychologists. Like she has a lot of data and a lot of mental health professionals that she cites like within the book who agree with her. I can comb through the book to pull out a few like examples of people like who have stated this. But one of the things that like I wanted to respond to you about Wick is the problem with like you meant medical culture. It's not the problem with surgery, it's the problem with the surgeon. Like they're just a bad surgeon, right? Like and I don't disagree with you, right? But the difference is that if there's a bad surgeon, right? And if you nick somebody's kidney And after you suture the wound and they've healed, and now like they like have and now they're bleeding from their kidney, they have a huge health problem, you could be sued for malpractice. You could be sued for
Mm.
malpractice. There is a negative outcome
Can
that
you
happens
not
to you
and
for
I'm ignorant on this, but can't you, if a therapist really screws you over, can't you like, isn't there like ways, like I remember seeing and you guys are gonna laugh, but I was watching Cheaters the other day, okay, and this lady cheated on her husband with her therapist, right? Like her and things like that. Therapist lost his license, right, because he practiced bad therapy. Like he was bad at his job. He did harm. So isn't there, much like there's malpractice if you have a medical thing go wrong? Is there not a similar thing for therapists?
No, there is the same medical malpractice law. The issue is that the standard of care in a medical malpractice case. So medical malpractice is basically just professional negligence. And typically in a negligence action, the standard of care that a defendant is held to is the reasonable person standard. So you are expected to behave as a reasonable person would under the same circumstances. However, in medical malpractice cases and like in legal malpractice cases, you're held to the professional standard of care. So the defendant is held to the standard of an upstanding, like, or a member of that profession in good standing. A member of that profession in good standing. Well, in psychiatry and psychology, it's like way more debated, like hotly debated, than it is arguably in other areas of medicine because all the diseases cannot be like materially verified to actually physically exist. So it's a lot, you know, you have a lot more room for error. That's the
Certainly.
argument. Is that, yeah, medical malpractice law, same thing, but it fails the it fails the plaintiffs in the psychiatric
Mm.
context in a way that it doesn't in other medical situations.
$5 from Testicle Johnson to say Testicle Johnson. I love your name, buddy. I want to hear what the alternative is besides
Mhm,
something nebulous like fix the culture. We heard the
mhm.
problem. What's the solution? And if I may, let me expound upon that. And this is my words, not Testicle Johnson's. But again, like, let's assume all this is true that both of you have said, right? And I have no reason to doubt it. But let's just assume it's true. You've heard the expression, sometimes the cure is worse than the disease. I would wonder, right? I would think that any cure I'm thinking of, like, oh, okay, so we close off the language around therapy culture. We really gatekeep it heavily and steadily. Um, I can see that being even worse than what is happening now. Because again, I don't think, and I've yet to be convinced, that that is the actual problem. But please, ladies, convince me. Go ahead.
So is this the idea that like it's better that at least like therapy is better than nothing? Like is that the essentially like we're in
More
a crisis, you
therapy
know?
being more available and readily accepted by the society is better than it being stigmatized and seen as this mystical in the military. This was a big one
Mhm,
in the military, right? And they had a whole campaign to fix this
mhm,
stigma because people were worried if you went to therapy, you would
mhm,
lose access to your security
mhm,
clearance, right?
mhm,
That you would, people would call you crazy, etc. So again, because the military has huge problems with suicide, they
mhm.
were desperate to try to fix this by getting people to go to fucking therapy, right? But it was
Right.
so stigmatized because everyone was like,
Mhm,
"Oh, there's so much." So I guess my bias here is I've
mhm,
seen the opening up of therapy culture in the military, and it's not perfect, but it's
mhm.
it's better than what it was before.
So so I would say I would agree with you, but it again with this asterisk next to it, which is what do you mean when you say therapy? That's a huge piece of this, and that's part of the problem with therapy culture is that so this is something that like the Schreier mentions in the book. There are some therapists, there are some licensed psychologists who practice actual CBT, who practice DBT, that have like there are lots of things that fall underneath the umbrella that we call therapy. Therapy could mean that you go to a rigorous DBT program. It could mean that you go to a rigorous CBT program. It could mean that you're going to a licensed, clinically trained professional that has scientific backing, and you are going through a program that is precisely catered to your needs, and it's evidence-based and effective. That could be it. Or you could wind up going to someone who says that they are a therapist, who purports that they are, but uses practices, as Allison said, which are faulty, which are outdated, practices that don't make any sense, tools that are really more based in pop psychology than they are in actual, like, any, like, medically trained sense. So I'll give you an example. When I was trying to look for a therapist, I think it was like it wasn't last year, it was about like the year before that. Um, one of the people that I like, because I had no idea, I was trying to find someone. I was trying to find someone who I could afford, someone who was local in the community. And this person, like that I found, she was an older woman and she gave me a discount. She was great because I was a student. And she asked me to take, the Enneagram as a psychological assessment
I don't know what that
before.
is.
So for those of you who don't know, if you've heard of the Myers-Briggs test,
I
it's a
know what that is. Yeah.
yeah, the Enneagram is like that. It's not a real psychological assessment. It's not really like a mental health thing, actually. It's not based in any real evidence or scientific training. Like it's basically astrology, for psych students. Like that's really like what it is.
I'm an
But
ENFP or something. I forget what I am, but I took it when I was a
I
kid.
believe
Yeah, I
it.
remember.
I believe it. But this is the problem, right?
I
So
think that's what I am.
is that
I don't
true?
know for a fact, but I think I'm ENFP.
Twinsies! Okay, but go on,
Twinsies.
please. Sorry, I didn't
Okay.
mean to
That
distract.
that's all. That's awesome. Uh, but yeah, no, so that's the problem, right? So what is the therapy? That's the question I've often asked people, like when they talk about the therapy, you need to go to therapy. Therapy is so important. Okay, take the word away. What is it that you really mean when you say therapy? Do you mean going to a doctor, like with tons of evidence and with the training, who is somebody who's actually like licensed and actually qualified to prescribe you this? Or are you talking about someone who is, you know, maybe they do have a license and maybe they do have some credentials, but they're not credentialed to help you in the specific way that you need, right? And most of the time, right, like for the average person, and I'm sure it's true that some people who went to see, her name was Carol, but you'll never find her. I'm sure a lot of people loved going to Carol and found taking the Enneagram to be extremely helpful. And I'll tell you something else. I don't think that Carol sat in her office and thought, ooh, how am I going to maliciously suck money, out of all of these people, right? And manipulate them. I don't think that was a process that sat in Carol's head. I don't think Carol was a malicious person. I don't think and frankly, many of these people that use, these practices that don't really work or work outside of the scope of their training, I don't think that they're malicious people or that they're actually planning to manipulate or take advantage of like their patients. I think many of them believe that what they're doing is fine. The problem is that wanting to help and actually helping are not the same thing. And being a well-intentioned like healthcare practitioner is not the same
But
thing as being an ethical
wouldn't it be
healthcare practitioner.
nice? Wouldn't it be nice if there was a culture around knowing the terms and knowing what was good and bad and what a good therapist was and a bad therapist was, so when someone did seek help, they could identify and recognize signs of a bad therapist? Wouldn't that be nice? Wouldn't that be great?
It would be great, but then the question becomes, well, I'll let Allison go because I've
Oh,
talked for a
please.
while. Allison, you answer first.
Okay, so I feel like I have this idea where there was a super chat earlier, and they were basically like, "What is the solution?" Y'all are basically just like, I mean, he didn't say this. I think it was Testicle Johnson, but he's basically suggesting your only solution is conservative culture war fodder. Like this is like a criticism of people who talk like, at least me, all the time is like, "Oh, all you have for these people is pull yourself up by the bootstraps." Like, fuck you. But I don't think so. I feel like there's this kind of false dichotomy where people think like we either go back to the 80s where like Dr. 𝕾𝖍𝖙 she wrote a book called An Unquiet Mind, and it is such an amazing book. And I tell people, if you have a relative or a loved one with bipolar disorder who won't take their meds, get them to read that book because she's the co-director of the mood disorder clinic at Johns Hopkins, and she was able to hide that she had manic depression until she got tenured herself. And she's written clinical textbooks on bipolar disorder that she wrote before anybody knew she had it. So it's not like she's somebody who appealed to lived experience and people paid attention. Like, She established herself as a titan in the field of treating manic depression, and then her husband died and she tried to kill herself with lithium, and so it came out. Okay, but like she's fucking amazing she's fucking amazing, okay? But there is kind of people critique another book of hers that she had where she talks about or well, let me start on my original tangent. In that book, An Unquiet Mind, she talks about how her, an extremely intelligent, professional, highly accomplished woman, it was seen as perfectly acceptable for her primary care doctor to unironically recommend sterilization to her, like voluntarily getting her tubes tied because she had bipolar disorder and there's a hereditary component. So like why the fuck would you want to reproduce? Like that was seen as perfectly fine to just literally recommend a woman who was not interested in getting the tubes tied to just do it. Okay? We arguably went from that kind of culture to mental illness is romanticized, 13 reasons why is held up as like, oh, really important conversations about mental health, when like I think a lot of insane ideas about mental illness are propagated by that show. And I mean, there's just like, I do think maybe the solution is a little bit of a culture war, a little bit of a cultural pushback, because there was a very strategic effort to destigmatize mental illness because fucked up stuff was happening. Like what Wick said with the military, like what Kay Redfield Jamison said, where she was like, I was a, psychiatrist and a professor, and doctors with like half my resume were telling me to get sterilized. You know what I mean? Like we went from that terrible culture to people unironically listing psych labels in bio like it is just an interesting thing about them. You know what I mean? Like, and I do feel like the answer is just a little bit of a cultural pendulum swing. We don't need to go all the way back. It's not a false dichotomy. We don't have to go all the way back full reactionary to say, hey, the cultural libs on the mental health question, they've gone a little too fucking far. I don't think we have to go all the way back to say that as a society. And I do think that's maybe the answer, but I know that's not very satisfactory.
So I have a little bit of a different answer from Allie. My answer is different. A little different. I do think that there needs to be some cultural pushback, but I think that a lot of this boils down to a crackdown on really being excruciatingly clear with what it is you mean when you say therapy. That term is way too vague. We need to have a crackdown on being extremely careful about like whose services like you are, like who you're paying for and who you're trying to look for. Like, so if you are someone truly in need of therapy, and if you're truly in need for a crisis, like there needs to be like a tightening of the belt around standards for who people choose to see in like when they are in crisis. One thing I will say that I think like has gone alongside, and I don't know if this has gone along. Actually, I don't know that, but I actually don't know if it's actually increased or not, but this is a sense, this is an opinion that I have. If you disagree, you are free to do so and you're pretty free to provide evidence. But wellness culture is something that is often intrinsically tied up with the
Wellness
concept
culture.
of
Can
therapy.
you explain what that is? Just also $5 from the Trib. Not everyone needs nor wants the same help or type of help. Different strokes for different folks. Also, some people can't be helped or aren't willing. Thank you for the $5. But yeah, wellness culture. Can you explain?
So wellness culture, It's it's basically like it's bullshit medicine is really what it is. But it's not actually like harmful. So it's like you're going to put like a spot of charcoal in your smoothie, and that's supposed to really help you, like, to help with your blood pressure, for
Oh, are you
instance.
talking about
Or
like
you
these
buy
oils,
grounding
essential oils and shit
or
like that?
essential oils, yes,
Okay.
or you go, to, or instead of like getting the cancer treatment that you need, you instead go to a mountain, and you decide to fast for a month. Or instead of actually like getting surgery, the surgery that you need, the scary surgery that you need to survive, you instead decide to meditate for a month, and you decide to reinvest in health, or you try a crazy new diet. Like, there's a great documentary series on this on Netflix if you guys ever want to check it out, and it talks about these crazy health trends. So people buying black market breast milk because they think it makes their muscles pump.
Black
People
market breast milk?
people Yeah, I'm not kidding. Like people will like buy like bodybuilders. They will like
Wick is
some
asking
weird
for a friend.
No, that's wild to me, but go on, please.
yeah. Or women who will like unironically like get their like have bees sting their face, because of the benefits that it has to the skin. Essential oils, that's a huge one. And I'm sure it might be the case, like just like with some forms of therapy, there might genuinely be some people for whom their salt lamp and their essential oil diffuser really does bring them joy in their life and really is, like, it really was the boost that they needed. And for the vast majority of people who don't have very serious problems, maybe that's a different conversation. But the problem happens when you have somebody who actually does have cancer, or you have somebody who actually is diagnosed with
So
schizophrenia, or you have
I
somebody that
get you.
actually is
No,
suffering
I'm
with a real
picking up
problem.
what you're putting down, but see, the problem is, right, is that simultaneously both of you are saying something along the lines of too many people are seeking out therapy when they don't really need therapy, but also, oh, essential oils, black market breast milk, and these other things, right? Like, you really shouldn't seek them out, right? Even if you have only minor issues, because you could have something bad and you really need to go to therapy, right? And so it seems like we're getting mixed messages, or I'm
I
getting
understand.
mixed messages. Does that make
Well,
sense?
I think that like our perspectives are a little different, which is part of the reason for that. But the second reason is that I'm not saying that people shouldn't go to therapy if they need it. What I'm saying is, like, people who are therapists or people who provide these types of services, we should have a cultural pushback against them and
I
against their practices, and
I'm with you.
demand more transparency, and demand, more accountability, and demand to raise the standards and professional standards of people that purport to be providing this care.
I understand, but that's not a culture issue because, again, like, how do I know?
I disagree.
How do I? And we'll get into it. I promise you. And I see you, Allison. Don't worry, we'll get you in here too. But things like you should go to therapy if you really need it. Unless we have a culture where people are aware of the warning signs of possible mental issues, right? And I understand that for the extreme cases, we all know, okay? We all can see it, okay? Everyone's aware. I have family members. I don't need a degree. I don't need anything to understand that there's something wrong. But for less extreme cases, right? How are we, or how is anyone to know whether or not they actually need to go to see someone unless they are aware of some of these warning signs, or they go to see someone to check it out, to get like a physical, if you will. Like, you go to a physician, a doctor, you get a physical, you may be perfectly fine, but it's good to have a checkup. For me, what I think the benefits of everyone going to therapy would be sort of a mental physical, if that makes sense. I know that's a weird words to put together, but like to get a checkup, to say, hey, I think I'm good. I've had some sad times, but I don't want to check and make sure. What is inherently wrong with that?
I'll let Allison go and then
Go ahead.
I'll answer. Yeah, because
I don't think there's anything wrong with that if you have a healthy view of like psychology and therapists and psychiatry as like, in my opinion, a uniquely fallible field that yes can be invaluable and life-saving for people, but that also is like uniquely susceptible to fad like thought and just issues and like cultural oopsies. Okay. Sorry, no other field of medicine has, and they've all had cultural oopsies, but psychiatry has it at a rate that far surpasses the other fields. And I think that's like inherent to the nature of it. And as long as you know that, and as long as, I mean, I think, in my opinion, the only type of useful therapy is the type of therapy with an explicit goal. And like, if your explicit goal in mind is just, hey, I'm just making sure that like nothing I say scares the fuck out of you, and like you can tell me if it does, like, then that's okay. But I do think that when people who are generally fine going through basically normal stuff, if not unpleasant stuff, basically normal stuff that humans have gone through and made it through forever, and you feel like you're fine, and then you just go to a therapist unquestioningly, it's like you it seems like you have nothing to gain except risks. And you might be completely fucking fine, right? You might not have like your memories rewritten by somebody who's fucking convinced that your body holds on to memories of trauma from your childhood. Okay. Like maybe you'll be fucking fine, but maybe you
But you
won't.
know what it
And if you
sounds
don't
like,
have that like healthy criticism,
Allison?
then I think that's the issue.
Allison, you know what it sounded like to me that you just said, and I know you didn't intend to say it this way, but what it sounded like is, don't go to therapy. They'll rewrite your memories and you'll come out a
No,
changed person. That's what it sounded like.
Well, no, I don't think that that's guaranteed to happen at all, but I think it is a risk. And I think that a lot of people aren't even willing to admit that. I think a lot of people are like, oh, yeah, of course, therapy's always fucking great. The Body Keeps the Score is like a really valuable book. Like, like, I don't, have you ever heard somebody talk about The Body Keeps the Score? Like, that is an,
Not until you, right? Like, but I don't,
we
right?
had and Brittany Simon seems like a nice person. I bet Brittany Simon believes hardcore in The Body Keeps the Score. Brittany Simon, who thinks any negative experience can be a trauma,
I don't
that's the
know.
exact type of motherfucker who believes in The Body Keeps the Score. I would bet my checking
She was
account she
watching
is.
earlier. Brittany Simon, if you're
Okay,
still here, do
please
you know what that book
confirm.
is?
Do you know The Body Keeps the Score? Do you like it? Because
Brittany
I bet
Simon is
yes and
saying you're
yes.
making a lot of assumptions.
I am. I am. I'm guessing. I'm guessing.
I don't
But I
know.
have a guess that she has read it and that she likes it.
She said it's just a book. She hasn't saying any, like, if she confirms, if she wants to confirm, she can. But like maybe, like, I've read books, right, that I don't necessarily agree with either, right? Like I've read and I consume media that I don't agree with all the time, right? So simply because she's read it, I wouldn't mean that I don't know if she puts stock in it. Like, you'd have, this is the
In my
conversation you'd have to have
opinion,
with her. I
well,
don't know.
it's not Brittany Simon. I like her, and that's why I used her as an example. Okay, because I find her likable, and like I can disagree with people that I like, right? That's like fine for me. So I like Brittany Simon. She seems
So
very nice and likable.
she says, I've read parts of it. It's fine. I've read 2,000 plus books. All things teach you something. Even the Bible is flawed.
Well, I would say the Bible's very flawed. I'm not religious, so yeah. But I would say The Body Keeps the Score. Frankly, if you're a mental health professional and you participated in false memories, I don't give a fuck about what you have to say. And if you have a book that's on the New York Times bestseller list for 200 weeks and it's not moving, and we don't consider this a massive cultural problem, I think that's a bad thing. I don't think that's any other book. That's somebody who participated in a medical scandal who is like enjoying a lot of cultural popularity and success. And his teachings influence the way that educators frame mental health initiatives in schools. Okay. So I don't think it's just another book. I think it is indicative of like an issue where certain psychologists and psychiatrists that do happen to be more socially left wing, okay, they have, I mean, I think quasi spiritual beliefs about trauma and about like childhood experiences and like it sounds a little Freudian, okay? It's dressed up differently, but I think that like a lot of bunk shit is like pretty popular in the field, and I think that there are really great mental health professionals out there, but I don't think the popular culture recognizes that this field is as flawed as it is.
Can I ask? I want to ask you a question, Wick, and just to sort of answer like the temperature check question that you asked earlier. Okay.
69
Um,
degrees. Go on.
how are you feeling right now?
I'm fine. I'm good. I'm
What identify the emotion you are feeling right now? What is that emotion?
amusement.
Amusement. Okay.
Yes, I'm
So
amused.
so the reason why I'm asking this, right, is like so
Well,
like if you
I feel
asked
lots
me,
of emotions all the time, right? Like, so it's
right?
not just amusement. There's quite a few, right? I'm
Mhm,
amused. I'm nervous. I'm frustrated. I'm happy. I'm sad. Like, all these, it's a
right.
mixture.
It's a
Okay.
mixture, right?
Yes.
So here is the issue with asking somebody how they're doing, right? Like with how they're feeling, with doing the temperature check, right? So if I go to you every day and I ask how you're feeling, you probably feel like I care about you. That's definitely true, right? If I am consistently doing a check-in, so it establishes rapport between us because I'm asking you the question. But it also results in a couple of other things. First of all, we all know what happens when you ask the majority of people how they're feeling. They lie. They say, "Oh, I'm doing great. I'm happy. Oh, I'm okay. How
Because
are
it's
you
a
doing?"
pleasantry. Yes, that's a pleasantry that we do. It's one of those script things where you, hi, how are you? I'm doing good. How are you? Oh, my day's fine. Yeah, how are the kids? Kids are great. How's the weather? The weather's fine. Yeah, it's a script thing, right? No,
I
most people, when they ask you, how do you feel, don't actually want to know how you feel. They just don't. We
Right.
know that. And so we don't
Well, I
give them a
I I
serious
understand.
answer.
Well, what I'm trying to say here and to express, like, with the question is that it sort of, like, inculcates the idea that, like, if you are not happy, that there is something wrong. And actual happiness, actually experiencing happiness, like, for the majority of people are not happy, like, and that's actually I'm gonna put it to you this way, most people, like, throughout human history, they don't feel happy all the time. They feel bored, they have some, like, low grade of negative emotion. Even, like, in this conversation that we're having right now, like, am I happy
Mm,
right now? I don't know if I'm happy. I'm interested, I'm focusing on the conversation I'm having with you, but I'm
sure.
not delighted and joyful. So when
You
you
should
ask
be.
people, like,
Everyone should be. If you're
well,
not, there's something wrong with you and you should go to
well,
therapy.
but you know what I mean, right? What I mean is that, like, it encourages you to focus on achieving a state of happiness as opposed to achieving, like, being interesting or focusing on a goal. When if you it's a like, what is it? There's a quote out there, like, happiness is a little bit like an orgasm. The more you focus on it, the more likely you are to lose it. It's the same thing. The same is true for most people in life, according, and this is
It's a
the
very
opinion that Schreier has.
female saying, but fair enough. Go on.
But I think it's a true saying. I think if you focus, like, so much on being happy, I have to be happy. How can I make myself happier? And if I'm doing this check-in, if I'm not happy today, and that's the point of the check-in, to see, are you happy today? And you're not happy, it sort of reinculcates the idea that if you're not feeling, if you aren't experiencing a positive emotion that day, that must mean that there's something wrong with you. Something that needs to be fixed, something that you need to have some sort of outreach or help for. And that's not true. And not only is it not true, but now let's pretend, instead of me asking you this, in a very chill, cozy, we're sitting down, we're having a conversation. Instead, I ask you this: how do you feel? And you have a backpack full of hiking gear and you're at the foot of Mount Everest and you're about to climb the mountain of Mount Everest. Okay. There are bodies, people have frozen to death towards the top. It's dangerous. You don't know if you have enough food in your pack. It's cold. You wonder if your fingers are
Yo,
going to
if
turn
I'm
black in the
wondering if I have
freeze.
enough food in my pack, I'm going to go and make fucking sure, right? Like, if I'm about to go skydiving and I'm not sure that my parachute is packed right, I'm not going skydiving. But I understand your point. Go ahead.
Yeah. Yeah. And the point that I'm saying is, if you go to someone before they're about to do something risky, adventurous, before they're about to do something challenging or hard, before they're about to tackle something monumental and huge, and you ask them, how are you feeling? If you do that emotional check-in, they're less likely to be successful in that endeavor than if you hadn't asked them at all. Because by
What?
asking,
Do you have?
yeah,
I don't believe you.
I think it makes sense, doesn't it? Because if
No.
you go and you ask somebody, if how are you feeling before they're about to jump out of the plane and go skydiving, and they say to you, I feel terrified, I feel scared, oh my God, what if I'm going to die? Which is the very realistic reaction you might have. You're more likely probably to sit down in the plane and not to jump out of the side and to go perish and to explode your parachute out of your backpack. And that's the danger of, like, the daily temperature check-in, is that, like, it encourages you, instead of focusing on the task ahead, instead of focusing on doing things that will make you happy as a side effect, it instead makes happiness the goal itself. And by making happiness the goal, it makes happiness that much more difficult to reach as a consequence.
I that last bit, I'm not sure if I disagree with, but I disagree with almost everything you said before that, right? So I think it is a good thing to check in with people before you take a step or before they take a step that's even challenging, right? Like, are you ready? Are you good? Are Allison, what are you doing?
I don't know.
Allison, have you been hanging out with Sunday too? Okay. Is that what's been going on?
Okay, so the computer that I was on just turned off, and the person who knows how to work the computer is not here, nor is he answering the phone. So I'm trying my best,
We
but
will do what we can, gang. Thank you for being here. We'll get to it. To my point though, right?
I don't know
Like,
if y'all can see me or not.
we
I'm
can't
just
see you yet. I don't know
you
if you
can.
cannot.
Oh, okay. Well, I'm trying to turn the camera on, but
As you figure that out. Oh, now there you are. Oh, there you were. You were, but then you went away again.
wait, you can see me now,
Yes.
like my face.
Yes, your face.
Yes,
Oh,
we
okay.
can. We
Hi.
can. And you look lovely today, by the way.
Hi.
Okay, that's funny. I can't see my face on my end. I'm so sorry to interrupt.
No,
No,
it's fine.
continue.
How you feeling?
I'm a little. I was gonna think of something funny to say. I can't. Women aren't
It's
funny.
okay.
Sorry, guys.
It's true. But regardless, there is this idea, right? Like that, yeah, the whole idea of don't ask someone how they're doing before a challenging or a good event because they're less likely to succeed at that event. I would need to see something that bears that out because
Sure. Sure.
intuitively it does not
Sure.
make sense to me. Now, are
I
they
can DM you a study right now, actually, that
okay?
backs that
DM
up.
me the study, but I'd have to look at it. I'll do it on my own time. But because again, just to yeah, we can DM Google like Google IamRight.com, right? And like you'll find a study. But regardless, um, what I'm trying to communicate here is that I think that the concept of wanting to be happy and working towards happiness is a good thing to do. We want for people to do that. Now, that said, right, you cannot get caught up in this. If I don't feel ecstatic all the time, then something's wrong because that's not how this works. And instead of happiness, I would replace it with contentment. And this is something that you can do. You can be content even in very trying circumstances. That is a thing that can happen. We have whole ass philosophies about this. Taoism, Stoicism, all these things where people work towards and provide ways for contentment, even in peace, even in trying and struggling times. So I guess I just disagree with the assertion overall. But please.
I would just I think that like we're in an impasse then. I do think that it makes sense. And I think that there are studies that back this up because it's the difference between task orientation as opposed to state orientation, okay? There's a difference between focusing on trying to achieve something and then I think that it's been shown to typically speaking like so I get what you're saying. What you're saying is like you should focus on contentment as opposed to happiness. And I really want to be very
If
clear
you
about
are
what I
not
mean.
content with how you are, then it's much like pain, right? People say pain is bad. That's not always true. Pain is a way of your body telling you that something is wrong, right? That there is something going on. That stove is hot, right? Your back is out, right? Something
Mhm.
is amiss. Okay? The same with mental states, right? If you are not feeling content, you need to be able to identify why. What is the cause of my why is it the season of discontent,
Mhm.
right? What is going on? What is happening where I am discontent? And then you
I
can
I s-
identify why and seek to either fix it or fix your relationship to it. Does that make sense?
It does, but I don't know that I agree. And the reason why I disagree is because it's not that so I to be very, very clear, I'm not saying that we should all be miserable and we should cry into our hands, with discontent, right? I'm not suggesting, that like the misery is like what we should all embrace. But what I am saying is that and I do think that it's important to be able to handle, life's trials and struggles when they're thrown at us with grace and to be able to pick ourselves up and not to dwell in a pool of self-pity. I would agree with you on that. If that's what you mean by contentment. But to make contentment the goal, to make happiness the goal, it's a self-defeating pursuit because the more I focus, it's a little bit like I need to be happy. I need to be happy. It's like the Seinfeld episode where the man says serenity now, serenity now. Whenever you're angry or you're upset, just say serenity now. And what happens? Well, what happens is if you've seen the episode, okay, the man just becomes angrier and angrier. George Costanza's dad just becomes more and more upset the more he says serenity now over and over and over again. Um, I would say that when you direct your life towards the pursuit of a goal or towards the pursuit of helping other people, towards the pursuit of being friend and just the pursuit of trying to create something that that is a pursuit that will not always make you content and it won't always make you happy, but it will give your life drive and purpose. And you will have moments of contentment and you will achieve contentment as a
I
consequence of
will
that.
pass the ball to Allison real quick and get her in on this because I disagree, but we'll see what Allison says and then I will weigh in. Go ahead.
So I like of the public facing like clinical psychologist types that talk about this stuff. There is sort of like a culture war raging where, like, in the popular progressive idea is that emotional awareness is basically inherently liberating. There's something really powerful about knowing exactly how you fucking feel all the time. And then there are mostly conservatives who say, no, that's called neuroticism. That's called being self obsessed. That's what that's called. You would be better served by thinking of yourself less, actually. And I mean, I think probably the correct answer is somewhere in the middle, but I think that the like cultural libs have way more cultural sway right now, and we're seeing the like excesses of that run amok, and I think we're seeing that most in like teenagers. Um, but I mean, that's just like my intuitive belief. Okay. And so that's why I mean I don't I think that if the like hardcore consult like the worst example is Matt Walsh literally unironically sharing propaganda materials from the quote unquote Citizens Commission of Human Rights, which is just the Church of Scientology's anti-psychiatry non-profit organization, literally. Okay, so like the cultural conservatives that are like super hardcore, they just can't completely fucking get their way either. That would be a bad society. But right now, the like progressives that just want to validate everybody's fucking feeling, even when it is unreasonable, they're winning. So that's why I'm here bitching about it, frankly.
No,
There's
I agree with you. Oh, I'm sorry. Go ahead, Fairy Queen. Didn't mean to cut you off.
Oh, no, no, you go. I have a different separate point after.
Okay, fair enough. But I understand, right, that no one should or can. It would be weird if everyone was like ecstatic and joyful 100% of the time. That's weird. And sometimes you do have to sacrifice your mental well-being to get something done or to help others, right? To a point, though. To a point. And I think it is good for a person, and I think it is a mark of a healthy individual to be able to identify what they are feeling and why. And we could, again, it's not always bad to be sad. There are valid reasons that, hey, this upsets me, and it's okay that I feel upset at this point in time, right? I think that being self-aware, emotionally aware, and being able to regulate emotionally is the mark of a healthy mind. That said, we cannot, right? We cannot just entirely abandon our own mental health, right? Or our own mental well-being. So, for example, there's a quote in the scripture, right? Physician, heal thyself. You cannot help others unless you yourself at a place to be able to be at least somewhat functioning. Now, I think how this ties into therapy culture, right, is this idea that, again, that you guys have pushed, that access to therapy and people talking about how therapy is a good thing and people should go to therapy is having a deleterious effect. I would wonder, and I would push back on that and say that I think that the reason we are able to identify how we feel better is because of the therapy. And so it's not so much a rate that the rate is entirely spiking just because there's more neuroticism. It's that we can identify neuroticism better, and people are more willing to go to therapy because they're neurotic. Does that make sense? Go ahead. Very
So it does make sense, but I have a couple of responses to that. So the first one is I want to be very clear about what I am saying. I don't know if Schreier is saying this, but this is what I am saying. The pushback that I think should happen is a crackdown again on standards of what we call therapy and a demand for clarity when people say you need to go to therapy because it's just too. If you have an abusive spouse, you should not be going to couples counseling. For instance, if you have a spouse that is beating you senseless and you are told go to therapy, therapy is something great. It's not great. You should not go to couples counseling. That is an inappropriate like suggestion to have. If you are someone who is struggling with an addiction, you need to see a counselor that has legitimate background, the legitimate license, a legitimate qualifications to help you resolve your addiction. And the same thing is true with like most examples of like mental disorders or mental health problems. There are specific standards and specific qualifications that you need to have in order to properly address each of these issues. And when we make if therapy can mean anything, if therapy can be truly, if it can mean a person, handing you an Enneagram test to evaluate your mental state, and that can be called therapy, that's bad. It's not good that that is something that's normalized. Secondly, to your point about emotional regulation, right? Part of what it is to be an emotionally regulated person is to learn how to appropriately repress your emotions in certain instances. That is part of what it is to be an emotionally regulated person. It's something upsets me, it's sad. I'm going to find this tool to learn how to deal with it. I'm going to deal with it, and then I'm going to move on. That's the point. That's what it is to be an emotionally regulated person. It's I feel angry, I feel sad, but I'm going to stop myself and I'm going to move on. That's something that therapy should encourage and what good therapists do, what good psychologists do. But the issue is, right? How do you identify like not just like what you're feeling, but it becomes extremely difficult to identify what bad therapy is or what a bad therapist looks like. And it's difficult to identify that because of the fact that it's so normalized, because so many things can be therapy and so many people can say that they are therapists or claim that they're providing therapeutic services when in fact it really amounts to you receiving, the Myers-Briggs test as an assessment. So that's some pushback that I would have like to some of what you've said. Another point that I would make too, like regarding therapy culture that we haven't talked about, is the issue of product placement. So if you're like me and you scroll through TikTok, which will soon be
Oh,
banned,
gang, by the
seems
way,
like.
if you're enjoying this content, hit that like and subscribe button. Remember to super chat and donate to my give me gift subs and things like that. Anyway, carry on. You were saying?
Yes, and you should donate because it's great for your mental health to do so.
Look,
And
no one ever
that,
got sadder from super chatting to me, okay? That's all I'm
okay.
saying.
Okay. But like I said that last part tongue in cheek, but that's the other issue with therapy culture is there are a lot of things that sort of this is why I said it ties into wellness culture, products that are sold that are told they're really great. It's great for your mental health. It's so great. So and we there are so many examples of products like this. So weighted blankets, weighted jackets, that's an example of a product that's placed. Essential oils are unironically a product that's like pushed to people for the
Wait,
benefit of
weighted
mental health.
jackets? I've never seen, maybe
Oh
we
yeah.
just get different ads. I've never seen weighted blankets or weighted jackets being advertised as a mental health
Oh,
thing.
yeah. Absolutely. Oh, you're muted,
Yeah,
Allison.
you're muted,
But
Allison, if you're trying to talk.
yeah, there are lots of things. Video games,
Weighted blankets are
songs.
regularly advertised as like, oh, grab a weighted blanket during a panic attack. And okay, it is physiologically soothing, okay, but like
Mm.
I mean, but yeah, no, I see weighted blankets for anxiety, like marketed for anxiety all the time. I bet if you go to Amazon, just type weighted blanket for anxiety, there's a bunch of weighted blankets just like the other ones, but they claim to be the ones that are good for anxiety. Okay, like
Maybe,
And this
like I said, ads are tailored to us. Maybe I'm just, like,
also, I
more
might have a
mentally healthy.
computer
That's true.
Oh,
momentarily, so just give me one
thanks
second,
for
okay?
that. But I think it is true, and I think that there are companies and there are people who create products who take advantage of the fact that people view themselves as mentally unwell or view themselves or worry that they have a disorder or this, that, and the other thing, and they prey upon that to convince you to buy their stuff. And there's no this isn't the FDA. The FDA isn't going to come knocking at like the blanket maker's door to say, "Hey, is this actually effective at reducing anxiety?" That doesn't happen, right? But so
Is your
that's
advocacy that it should?
no, my advocacy is not that it should. My advocacy is that one thing I don't like about therapy culture is that I think it manipulates people into buying products and services that they don't need or directing people who do need those services towards products or people who are not qualified to provide them. That's the
I'm gonna
concern
hang
that
up
I
and
have.
rejoin on computer.
Sounds good. And
Hi,
I'll
Allison.
wait to have my rejoin. Oh, there she is.
Yeah.
Speak of the devil, and she, can you hear us? Can you see us before I have my rejoinder? You're muted on your end.
Allison, are you there? I think she's there. She's probably just figuring out the computer stuff right now.
Probably.
Yeah.
I just don't. Oh, give her a second.
Yeah.
Give her a second.
So, yeah.
Continue
Well,
with your spiel though, if you want.
yeah. So that's my concern. My concern is that like people are forking over cash for products or for services that are inappropriate to like what they actually need. That's a concern that I have, a big concern that I have.
Two things.
Yes.
One. So what? Right? I buy things I don't need all the time, right?
Mhm.
I do so like I will be bored at night and being a little like I'm bored, no one's up to talk to. I'm going to buy a video game and maybe that will make me feel better. Is that something? It's not being pushed that it'll make me feel better,
Mhm.
right? But it's something that like I get some comfort food maybe, right? Like
Yeah.
I buy some peanut butter and I eat some peanut butter and I feel more comforted. That isn't I don't think anyone or anything is doing something wrong, right? There's nothing immoral or even really harmful about that when done in moderation. Like, there are
When
things that
moderation,
make me feel better when I do
right?
them. And I think that if someone is doing something or paying for these things at a huge rate, right? That they're like spending all their life savings because they're addicted to gotcha games or something, right? That's something that needs therapy.
Right, but the question becomes like, do you feel like you have to eat that jar of peanut butter every night? Do you feel like if you don't eat this jar of peanut butter, that your mental health will decline? Like, I understand what you're saying. Like, we buy things that comfort us, that make us happy, like all the
Yeah.
time, right? So what if they say it's a mental health boost? Well, the issue with like saying specifically that it's great for mental health or saying it's great for reducing anxiety, it's great for this, it's great for that, is that it makes the suggestion to the consumer that if you are a person who you think has bad anxiety, has bad depression, this will help resolve your problem. You
So
need to have this weighted blanket.
Brittany
You
Simon
need to have
says
this.
Brittany Simon says weighted blankets do help with anxiety and for non-neurodivergent people. Is she saying that they never help or that they aren't going to cure you? Cures aren't always possible, so people look for ways to help.
I have a weighted blanket myself. Okay, I do use it, and like
Does
it
it not
does
help?
it does, but it's not enough. It's not nearly enough, and it's not good enough. Like
Okay.
if you're somebody that like is if you're somebody and so let me put it to you this way, okay? So I bought the weighted blanket because I thought that I needed it. I needed to have this weighted blanket, right? And if I didn't have this weighted blanket, it would like I was experiencing a lot of anxiety. It helped me sleep. I have problems sleeping sometimes. So it was effective for me. But it it sort of became this chain reaction where I found video games, there were products that were being placed at me that also said, "You need to have this for your anxiety. You need to have tea for your anxiety. You need to have a proper diet for you need to do all of these things." And the more you think about, "Oh, I need to reduce my anxiety. Look at all the stuff that I," the more anxious you become. It encourages you to focus on the fact that you have anxiety as opposed to simply ignoring it and learning how to move on.
Note
So,
back to the first thing I said at the very beginning of this, right?
mhm,
Note where you're getting that information from. Not culture, but from the social media which you consume. That is feeding you that. That is feeding you that directly into your
right, and I
eyeballs.
didn't which
And
I never
social
disagreed
media,
with,
as I
but
said, is the reason to tear, right? That this is happening. It is the majority of the reasons. All these things that you've mentioned can be solved if we fix social media. A majority, I won't say all, but a great vast majority of this can be solved by changing how we deal with social media, right? So I think that all this talk about these other things, right, is almost a distraction, if you
no,
will.
I don't think that's true. I think that you're right. I think that like social media is definitely a huge influence and it's a big piece of like what we're discussing. But I think that like we talk about that so much that we ignore this very relevant piece that me and Allison are bringing up. And this is the biggest problem that I have with therapy culture, like when we discuss it, is that it sort of encourages you to to think of yourself as a disempowered individual, to think that I can't get through life without the approval or with the seal of approval, with the exoneration of an authority figure like behind like in a white lab coat. I am not capable to get through like my parents' divorce. I'm not capable of getting through like this, et cetera, et cetera. I need to have your permission before I make this decision.
Yeah,
And this does
I see you, Allison. Don't worry, I see you. But the only people I hear saying that are on social media. $5 from Testicle Johnson. Weighted blanket is a good sleep aid. It strikes a balance between having a loving partner and not being sad enough to get a waifu pillow. Thank you for the $5. But go ahead.
what were you going to say, Allison?
Okay. Here, wait 1 second. I kind of just lost my train of thought. I don't know why. Something about that super chat just fucked me up. Testicle Johnson with love. I just got really scattered.
Okay, take your time. But I guess like maybe this will re-jump your thoughts, right? Because if you're trying to come at me for this, but like all these
Oh,
groups.
wait. I remembered.
Go ahead.
I do think that an enormous problem is social media. I like the biggest by far, like not by a little bit, but by far. Like I totally believe that, and I wonder why the American Psychiatric Association, the American Psychological Association, these allegedly medical professional societies that are really willing to jump right into political discussions. Oh man, gun control, they got opinions. Entitlement programs, they got opinions. Systemic racism, gender identity, they got opinions. Cell phone use in schools, oh, mum's the word. Fucking silencio, nothing. COVID lockdowns, nothing. Nothing. The argument is that this shit is dominated by cultural libs. And so they have biases and it comes out and like
Allison, I love you. I really do. But if everything can be pointed back at the libs, right?
no,
It's hard
fucking
to.
medical societies are lib controlled. I don't think that's like a fucking like is that disputed?
It's
Like the American Pediatric Association is like I think they regularly actually endorse Democrats. Like I literally they literally say like, oh, politics, it's like medical problems, it's a public health crisis, which like sure, okay, but it just seems like they have very fucking
Thank you for
clear
the gift sub,
biases,
Rabbit.
and it leads them to I mean, why is it that we didn't get one fucking statement about COVID lockdowns when you have like the suicide hotlines exploding? They're so
Do you
excited
not
to
think
talk
that
about
this
these
has been
very, very
explored?
niche.
But no, I can't speak for these
No, why
organizations.
did the
But these
but
things
that's
have been
it. That's
studied
it.
and explored. They've done research on this, right? We know the effects and how deleterious the effects of lockdowns have
Why
been.
do the medical professional societies not care? If we know, why don't the medical professional societies, who their whole job is allegedly to improve the mental health of the population,
is about
why don't they
institutional
care?
capture, right?
Yes.
And that is a separate argument, right? We can have that
My
argument.
argument this whole time has been that like very lefty progressive sensibility ideas about psychiatry and mental health are resulting slowly but surely in a more neurotic, fragile, breakable population. That has been my argument throughout, okay? And so
my contender to that is that we are not more fragile and breakable today because of the institutional capture of liberals in our American Psychological Association. It is due to the fact that we have a huge prevalence of the torture box, right, on us at all times. The torture box that we are encouraged to look at. The rage box. You guys all saw Dune, right? You all saw Dune? Do you remember that hand that Paul Atreides put his that box that Paul Atreides put his hand into? Our hands are in there, right? And we are loving it being in there, right? And it's just making us crazy.
True. But you didn't have access to this box in 1955. You didn't have access to it in the 60s.
I wasn't alive in 1955.
I know, neither was I. And you didn't have access to it in the 70s, and you wouldn't have had access to it in the 80s. If you were really, really lucky, you might have had like one of those huge Britney Spears cordless things like in the 90s. Like
Queen.
This has been happening before, like this, and it hasn't been happening. I agree with you.
Near the same rate, so
maybe, but it was still happening. It was still going on.
I think it's social media more than technology, more than the phones. It's social media. The phones didn't help, but I think it's social media.
I don't think that it's purely social media, though. I think that like it's definitely a huge significant factor, and I think it would be foolish to deny that. But I also think that like overestimating and overemphasizing it all the time.
Do you think
I
know what you think, Allison. I think
reduction policies on social media instead of cut them the fuck out policies, that is cultural liberalism. That is the cradling the addict and telling him that he has a brain disease and saying, instead of saying stop fucking doing drugs.
All I'm saying is
sites instead of withdrawal isolation
Allison,
rooms.
I'm with you. Allison, I'm with you. The more feminism has become popular, the more fragile we become as a species, right? Okay, I'm with you. No, but seriously, do you have that same critique, Fairy Queen, that Allison does? Allison's critique is that it's the libs. Do you have that critique? Please.
I mean, sort of, a little bit, but I have like with some caveats and with some nuance to
Explain.
So I do think that there is something to the idea that if you are somebody who is more left-leaning, that you are more likely to go to therapy and you're more likely to take your kids to therapy. And what we can see clearly, like and I think Allison has mentioned this before, that if you are somebody who's liberal and if you're a teenager, you're more likely to have a mental illness and you're more likely to struggle with mental health as opposed to conservative teens. Liberal teen boys have worse mental health in comparison to conservative girls.
You're more likely to be diagnosed with it.
It's not.
Yes.
It's not just that.
I think they measured internalizing symptoms, not even necessarily psychiatric diagnoses. Internalizing symptoms. I'll look up the study to be sure.
I would like somebody to look up the study, but I would guess, and I don't know. This is a guess that I have, that when we were looking again, like, at the chart that you mentioned regarding teenage girls being more likely to be hospitalized and more likely to go to, like, to be hospitalized for suicide attempts and for, like, suicidal ideation, my assumption is that, like, the vast majority of the girls that are admitted are probably more likely to be liberal based
Now
off of
let's
that. I
look at
don't know
actual,
that, but
like, now let's
I
look at
don't
the suicide stats of the people and groups who are killing themselves more, and I promise you, they're not liberal. They're people who are in rural America. They're people who are young men are doing this at astounding rates, more than young women, right? Then you look at the military, right?
Mhm.
Those three groups, I'm pretty sure are the highest three groups out there, right? That
Right.
do
But
this.
those
It's
right,
a
but those
terrible thing, and
It's
they
the
it is a
aren't
best
terrible
by
social
any
thing. I don't
history.
means liberal institutions.
I'm
So
not
I would
I'm not
agree
dis
with you. I would agree with you that yes, the diagnoses rate and people willing to admit that they might have some mental issues, right? Much more liberal. I get you. But when we look at the actual, like, who's killing themselves, and yeah,
Well,
it's
I was
these
specifically
conservative
focusing on
institutions.
adolescents. I was focusing on teenagers. I wasn't talking about adult men, and I wasn't speaking about populations.
Okay.
And all of those populations of people, like, specifically, like, with the military, I could be wrong, but my assumption is that, like, suicide attempts, like, and suicidality, like, within the military has been a consistent problem, like, and that's associated with being a veteran because you're more likely to have PTSD. You're more likely to suffer from legitimate trauma to have
And
seen
you're
somebody
less
shot and killed.
likely to get therapy for it.
Yes, and you're less well, that's true, and that certainly might be a contributing factor. But when we are thinking specifically about adolescents, again, not adults, not people with institutions, but teenagers, okay? We're talking about teenagers. If you are liberal, it is more likely for you to be diagnosed or for you to believe that you have a mental illness if you are liberal as opposed to conservative. And I would guess that you're probably more likely to attempt to hurt yourself if you are a liberal teenage girl as opposed to a conservative teenage girl. I don't know that, but I think that that's true based off of the data.
So
Allison,
Allison, do
what
you
did
have data for us, or you do have
Well,
it's the list again?
so well, no. So I do have that. It was internalizing symptoms they measured rather than any specific psychiatric diagnosis. Okay, but wait, fuck. I don't know why I keep like brain like blanking. Um, I had a specific point I wanted to say, but I lost it. But yeah, no, I have this the paper, the last name. It's called "The Politics of Depression," which they measured internalizing symptoms, not quote unquote depression diagnosis. Okay, diverging trends in internalizing symptoms among U.S. adolescents by political beliefs. So these were minors not capable of voting. Okay, so it was like self-identification as liberal or conservative. Um, but oh wait, what I wanted to say, there's a difference between suicide and suicidality. Okay, so like men are more likely to die by suicide because they are more likely to effectively complete suicide. Okay, they are more likely to use a gun and like literally eat a bullet. Okay, which has a very very high success rate. Okay, arguably females are more likely to do um parasuicidal behavior. Men do it too. Okay, but there is like two types of what they call parasuicidal behaviors, like appellative suicide attempts and manipulative suicide attempts. So the appellative suicide attempt is person isn't actually trying to die. They take an
Tension
amount of
versus
Benadryl that they
results. Yes,
yeah.
I
Well,
get
no,
it.
there's a cry for help, or there's a I'm trying to make a person in my life feel very fucking bad. You see this with certain cluster B personality disorders.
Yes.
That's called a manipulative suicide attempt. Arguably,
The goal
men
there,
don't
though,
fuck with
like
that as
in
much,
that,
and women do fuck with it more. Arguably,
and
that's what
man,
the
this
psychiatrists
is
say.
a.
So yeah, you see
I'm
more
going to. I'm
parasuicidal
going to
behavior
back
amongst
off.
teenage girls, and the male suicide remains higher because they are more effective. But teenage girls are doing the like non-intent to die self-mutilation more and more and more, cutting that's never going to result in like bleeding out. They're doing that more and more. Like they can show that it's like worse mental health, but you wouldn't expect them to necessarily die more because that's not the point.
And
I
I
am
just want to
going. Oh, go ahead. Do your thing.
Yeah, I just wanted to clarify, like, so I bring that up because I do think that like political orientation does have something to do with this, and I do think that it is. What were you going to say, Allison? I'm sorry.
The specific internalizing symptoms that these people measured when they said that specifically liberal teens are doing worse were depressive affect, self esteem, self derogation, and loneliness. So it was a collection of what they call internalizing symptoms, symptoms that are more likely to result in unhappiness rather than like any actual psychiatric diagnosis. That is what they measured. And the citation for that, it is the first listed author is 𝕾𝖍𝖎𝖙, 𝕾𝐺𝖬𝑚𝐵RONE, published in 2022, Diverging Trends in Internalizing Symptoms Among U.S. Adolescents
But I would
by Political
posit,
Beliefs.
that a large portion of that is due to how they are engaging with social media and the groups that they hang out with in social media. I agree with you that it is a very left-wing thing for people to identify with their mental illness. Yes, I agree with you that that's a negative thing. We should not do that. I push back against that. I think that is bad, right? I agree with you there. But I do not think it's because of the capture of institutions, right, such as the American Psychiatric Association and the others, these things, that are driving this. I think you were putting the cart before the horse in that case. But go on, and I
So
know
you
Fairy
don't
Queen had some stuff to say.
and Schreier basically points this out, like why like these medical professional societies, they seem to know, hey, this is making them more ill, and instead of just saying, hey guys, treat this like a public health issue, like don't give your kids a fucking smartphone. They make amazing flip phones that can text and call just like incredibly. They make wonderful digital cameras. They make wonderful music players. Like you can have your kid can enjoy modern technology without having the internet on his or her person at all times. Okay. Instead of embracing that, they social media harm reduction. Here's how you can totally still engage with social media, but do it responsibly. And arguably, that is equivalent to the more liberal policy on drug addiction, that like, oh, we give them safe injection sites and we just try to harm reduce. We take it for granted that the person is not going to be able to act in their own self-interest and cut out the unhealthy thing. We just assume that the person does not have enough impulse control to do that, and so we just take for granted that they're going to keep fucking themselves over, and so we just help them do it in the least damaging way. And that's where I say this like lib like affect, it is at the top of these like medical professional societies. And I think I don't think it's the reason. I don't think it's the reason, but I don't think it fucking helps. Okay. And I think it's obviously true.
Okay. So, Fairy Queen, go ahead, Fairy Queen. This will circle if we keep going, but Fairy Queen, please.
Okay.
Combo breakouts.
I think I agree a little bit. I do think that like political ideology does play I think that it's an undeniable role in how willing you are to identify yourself or to believe that you are mentally unwell, how likely you are to go to therapy, and how likely you are to identify yourself and to coincide your identity of self with a mental diagnosis. I think that it's just true that like if you are somebody who's liberal or somebody who's on the left, that is statistically more likely to be true of you as opposed to somebody who is conservative. And so I do think that like this issue around therapy culture as a consequence is something that is more likely to affect liberals. And quite frankly, I think more likely to be the negative aspects are more likely to be enabled by people who are liberals as a consequence. But I also think that this is due to some other factors that I've been trying to gesture towards. And one of them is money. So I think that as with the rise of social media and the rise of internet access, that I think that companies and I think that people who want to make money off of who want to be healthcare providers, who want to be healers. I think that there are lots of people who are willing to take advantage of people in order to make money. And they use like allusions to mental health in order to convince people that they are less well than they actually are in order to extract money and to manipulate them out of funds. So I think that money plays a huge role in this. It's been enabled more so as a business. I also think as a personal theory, we know that people are in the pews less. We know that people attend church less. We know that people are far less likely to be religious today than they have ever been before in any previous decade. And I think that it stands to reason that if you attend, like, even if just thinking practically about what it means if you are a religious person, it means that you attend a service with a community of people once a week. It means that you celebrate holidays together with that group of people. It means that you are actively physically involved in a community. It means you leave your basement and you go outside and you engage with them on Sunday brunch. These are activities that like physical things that push you outside that are encouraged by many denominations. And so, like, as because we live in a society that is less religious, that people are less likely to identify as religious, they are less likely to go to services, and therefore less likely, I would guess, to be more actively engaged with their local communities, which I think might be a contributing factor to poor mental health. Would be my guess.
I don't think it's the lack of religion, but as you said, the lack of community involvement. And we see this as the destruction of communal infrastructure has continued. We don't go to malls anymore. We don't go to parks anymore. We don't go to bowling alleys as much as we used to. Like, the communal infrastructure throughout the West has been in decline for a long, long time. Yes, churches are a part of that, but I don't think it has anything to do with religion per se. What I would
Well,
say what I would say, if I may, right, is that, like, this idea that we have less reluctance to say, hey, I have a problem with my mental health, there's X, Y, and Z. Like, I don't think that's necessarily bad. To the extreme, yes. But when someone is willing to say, hey, I struggle with depression, it destigmatizes it, right? It humanizes people who have this affliction. It helps people also be able to identify warning signs in their life. Now, I agree with your problems that you're pointing out, but I think the solution to that, if I may, just briefly, is changing licensing, changing how we view credentials, changing how we talk about, right, like, or how the institutions themselves gatekeep and are structured. I don't think that has anything to do with how we treat it in this space. I don't think that because I have an opinion on therapy, right, and its lack in its efficacy or lack thereof, I don't think that that's a huge contributing factor. In fact, I don't think it's a contributing factor. I think that the fact that, as you said, there's money involved and there are people who are advertising themselves as like, hey, come take this Myers-Briggs test and I can solve all your problems, right? Like, that's been going on forever. And I think that
it,
that seems to be what you're mad at. And I think that, like, the libs thing's got me cooking, right? Because it's not the libs that are doing this, right? This is just
You can cope and pretend. There's a
this is
reason why
money.
libs
This is
over-identify with
money,
psych disorders and
right?
not conservatives. There's a reason. It's not a coincidence.
Yeah, because the conservatives aren't willing to admit when they have a problem because it's not manly, right? Especially men.
Plenty of
It's not
conservatives are
manly.
willing to admit that they have a mental illness. They just view it differently than libs. Libs are more likely to view it as a permanent disability, a brain defect akin to diabetes. Okay, you're
That's not
way
true,
more
though.
likely to start hearing shit like that from liberals.
But
you are.
you snuck in this thing that just wasn't true. Like, that conservatives are more willing, are also willing to admit that they have mental issues. That's just not true.
Plenty of conservatives are. I'm not saying that there
But-
aren't issues. I talked earlier about how Matt Walsh unironically held up Scientology propaganda and was like, they got some valuable shit to say. No, they don't. You know what I mean? There are retarded conservatives on this issue. I'm with you, but they don't have cultural sway the way the libs do. They're not sitting at the New York Times bestseller for 200 weeks saying shit that was like thrown out in courts in the 90s and called the worst scandal since
biggest
lobotomy.
political influencers out there right now, Tucker Carlson, Matt Walsh, Tim Pool, libs of TikTok. Does the left have problems with this as well? We look at Hassan
What influence do
Piker.
they have in
We
the
look at
mental
Second
health
Thoughts.
industry?
We
When's
look
the
at
last
these
time
things.
the American Psychological Association said, yeah, I really give a shit what Matt Walsh says? That doesn't happen.
No, but people, right?
Besser Vanderkolk, whatever his fucking
We're
Dutch
not
ass
talking
name
about
is,
the
he
diagnosis.
is taken very seriously.
We're not talking about the DSM-5 right now. We're talking about how people in this space and people in the wider community view mental health and deal with their mental health. We're not talking about the DSM-5 diagnoses. We're talking about liberals and conservatives who identify with therapy, right? And how they go about dealing with therapy. If I may finish, and I'll let you go real quick. Again, like, we have huge influencers on the conservative side that have crazy ideas about therapy, and they are influencing how people deal with and associate with therapy. Do you deny
Not the powerful
this?
people. Not the powerful people, not the institutions. When is the last time the American Psychiatric
I'm not
Association?
saying the institutions. I'm saying
That's
it's
what I
the
care about.
customer
I'm
dealing
saying
with
the
the
mental health
institutions.
industry. I'm saying the mental health industry has got some fucking problems. I'm saying they're listening to cultural progressives a little bit too fucking much. That's my point. Is the mental health industry. I'm not saying that there aren't random right wingers that aren't literally materially harmed by Matt Walsh holding up Scientology propaganda. There are. But the institutions don't give a fuck about the conservatives. So I am not as
But
worried
they
about
are
them.
influenced by how people react to them, right? You understand that, right? If a clinic, right, has 100 people coming to them with certain problems and certain issues, right, they're going to respond to that. They're going to react to that. And you are correct that sometimes it's negative reaction, right? Like the more likely it is that a conservative would say something, the less likely it is that the APA or anything would agree with them. We could see this with COVID lockdowns. We could see with this with the how social media affects us, right? With harm reduction versus these things. I think that is a direct result of negative polarization because they don't want to be seen as agreeing with Matt fucking Walsh or all these libs of TikTok.
Well, they need
types
to
of
grow
people.
up. They
They
need to grow the
do.
fuck
I
up.
don't agree. I don't disagree with you. They do. There are issues here. There are big structural issues with therapy. Yes.
I win.
But that's not it, right?
My
Because
point
there's
isn't that you throw it
big
all out. The
issues
point is
as
that
well.
there's big fucking issues. That's my point. That's my only point.
It's big, but it's not my only point, right? And you can think that that's your only point, but it's not the only issue on the table. And again, as you would admit earlier, the biggest issue on the table, social media. Fairy Queen, help us out.
Yeah. I think I wanted to. Well, I wanted to just make a couple of comments, right? I also think that if you are, I think that if you are conservative, you're probably more likely to be religious. And if you are more likely to be religious, you probably are more likely to go to church, which means you're probably more likely, or not even church, to temple, to the mosque. Like you're more likely to attend services, which means I would assume you're probably more likely to go out and to be involved with your community for that reason. I would assume that that's true as a possible reason. And I do think that the religious aspect, I don't disagree with you that this is a lack of community involvement in general. So going to parks, going to malls, etc. I think that I think that's true. But I also think that there's something specific about faith. It's not just community involvement. It gives you a package. It's a very nice and neat package. It helps you discern your life purpose. You do have a community that you see routinely. You have a set of morals and principles, and even right down to your dietary habits that's handed to you. If you're Catholic, you even have a practitioner who you can go and who you can sit with and whom you can ask advice from. You know, I think that there have been people who have made even analogies between going to confession and between going to therapy. Except the difference is that if you go to confession, you're not asking the priest, what is the most mentally healthy thing for me to do? You're asking you're confessing, you're taking responsibility for your faults, for the bad
Have you
things
been
that
to
you have
confession?
done. Yes, I've been to
Okay.
confession.
Just
Yeah, I've been to
curious.
confession.
Fair enough.
Yeah, I've been to confession. I was. Yeah, are you kidding me? Of course I have.
I don't know.
I've
Well, I'm
been to
asking.
confession many times in my life when I was growing up in my house.
Fair enough.
Yes. So it puts the responsibility on you. You list all of your faults. You're told this is what you have to do in order to make it right. You're told to apologize, but you still have the chance to express what happened to you to someone else. And it's completely confidential. So, and I don't know, I would assume, although I don't know, that even though you don't have confession, I don't believe in Judaism, or if you're Mormon, or if you're Muslim, or if in many of these other denominations or faiths, you still have someone who is a learned person whose job it is to help to guide you spiritually in your path to walk in purpose. That is something that is a thing that you have as a feature of being a part of a faith. And I don't
I'll be
think
right
that
back.
that's
I can still
something to
hear.
just to put off the shelf. So that's one thing. So that's something that I wanted to chime in here. I do think that the religious aspect of it is important, and not just because it puts
So
you outside, but because it gives you
I
stuff
understand.
that therapy that
But what I
that's different from
what I
therapy.
would like to point out is how you came in, right? And you were saying, "Hey, the enneagram or whatever it was, Myers-Briggs, these are
You're right.
all being touted as helpful and therapeutic wellness
Yeah.
culture with going to a mountain, things, and these things are a negative
Yeah.
in how we deal with therapy culture." And now you're saying that, well, actually confession might be as helpful as therapy.
No, I understand what you're saying, and you're not wrong. Like that is very true. But okay. So I could see what you're saying. So like if we're going to slam on the Enneagram, we're going to slam on salt lamps and crystals, right? Like why are we like not slamming like religion? And you're not wrong for that, by the way. There are some faiths that will encourage you not to seek medical treatment, to instead have faith in God, instead put your trust in God. There are religions that you can be a part of that will actually say that it's a sin to seek certain types of medical health
We
care.
can
So if
we
you're
can look at the people, the Catholic. Catholic's a great example of this, and how when people would report the issues that they were having, instead of fixing the issue, the Catholic Church would just move people around, right?
Yep. Mhm.
Um, that did
But
not
even that
help.
But even that, I would argue to you, represents a certain failure of therapy culture, because if they didn't just do that, they did do that, you're right. They did take priests and then moved them to different locations.
Wait, priests
But
that were
before
assaulting children, to be
children,
clear.
yes,
Yeah.
yes. But before they did that, they would send these priests to a form of therapy to be rehabilitated. They were sent to therapy, they were sent to these institutions so that they could be cured, okay? The belief was that if they went to therapy, if they went to rehab, that then they would come out the other side and then they would be safe to be placed back within these different churches, within these
No, no,
institutions.
no, no, no. They thought that they had been absolved of sin because they went to confession, right, and absolved themselves and were cured by God.
This what no, 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 no. It is part that, but it's also rehabilitation. So a really good book on this for those of you who want to read this. It's called Sex, Priests, and Power. It's by Richard Sipes. He was the expert. He was a priest who counseled like many priests who sinned, who chose to like to be unchaste, who chose to sleep with people outside of like their vows, who molested children, who assaulted people. He interviewed thousands, he counseled, I don't know if it's actually thousands, but he interviewed and counseled many of these priests. And when the Boston Globe broke the story about like the priests like within Boston, like the AIDS who assaulted kids and when it was covered up, he was the expert person who was called on the phone who gave that testimony. And what he said very specifically was like what they would do is these priests, they would come into the office, they would receive counseling, they would receive spiritual absolution, but also counseling. And then they would be taken, and placed into another local it starts with an S. I forget like what it's called. I'm using the word
Parish?
synagogue. That's not what it is.
Uh,
It's what is it called? Diocese. It's the diocese. They would be placed
Starts
into
with
a
an S.
different
Yeah.
diocese. They would be moved around as a consequence. And that represents a failure, I would say, not just of a religiously based mindset, but frankly of therapy culture.
Okay.
The idea that it's enough just to go to therapy and that it will fix your problems. It doesn't in all cases.
Fair enough. We are coming up at the end of this discussion. I know you have somewhere to go, but I do want to get to some call-ins. So what we're going to do is we're going to do closing statements. Where can people find us? All that. And then we're going to let some callers in for the next 20 minutes or so, and we will have a good discussion. So gang, if you're liking this content, hit that like button, hit that subscribe button. Unironically, I've enjoyed this discussion, and it's been fun.
Yeah.
Tomorrow there will be no stream. I have a dental appointment. We'll see how that goes. And then Thursday, we're going to be talking about women's entitlement, okay? And then on Friday, we'll be having Hutch, Rico, the Happy Warrior, and maybe Counterpoints to talk about Gamergate 2. Tune in for that. Okay, with that, where can people find you? And closing thoughts. Let's start with Allison. We'll go to Fairy Queen, and then we'll get people.
Okay. Can't find me. I'm just here. I don't mean to sound alarmist, okay? I've had positive experiences with psychiatry and therapy personally, and I am very pro people with serious mental illness being medicated, okay? I think that's like, it's not fun. You're going to have to deal with side effects, but the symptoms of untreated serious mental illness are simply worse. So, I mean, that's where I'm coming from. I am not like anti psychiatry, but I do notice some like unfortunate, I think, pop culture things happening related to quote unquote mental health. There are some, I don't know. I just find that personally, the things that helped me get better are like not super popular messages, okay, in the popular culture. It's like, it's kind of, I don't know. I mean, I feel like I am just trying to provide a little bit of pushback. I don't want to swing all the way back. I don't want to overcorrect, but I think we need a little cultural correction. I think we went from uber stigmatization of mental illness to romanticization of mental illness, and we need a more happy medium.
Okay.
But that can be my closing statement.
Thank you. Fairy Queen, go ahead.
Hey. So first of all, you can find me at Fairy Queen's Cottage on YouTube, and you can find me at fairy_queen on Twitter. Um, and I wanted to end, like, I guess, with like just a very personal story about like me, like what helped me, like with. So I went through a really topsy turvy breakup. It was really hard, and my mental health was like in the shitter. I was really really sad. And this is not, and I'm not a mental health expert. Like, don't like, this is just my story. This is just my experience. What really helped me the most was, honestly, it wasn't so much the therapy. It was nice to go to therapy. It was nice to talk to someone. But what really helped me in the end, it was honestly, like, it's going to sound so stupid, but it was diet and exercise. It was having a goal and removing myself from like a negative environment and finding people to be true, genuine friends with. That's what helped me. What helped me was finding a purpose, was sticking to a routine and trying to do things to be task oriented to objectively make my life better. And and I'm not and just like Allison said, I'm not discouraging people from going to therapy if they really need it, if it's something that you feel is necessary, but if you're going to go and if you think that you need it, I would suggest and I would highly encourage you to try to find someone who is old, very experienced, and someone who is extremely well credentialed. Do not cheap up like trying, like, I know it's a lot of money, I know it can be expensive, and sadly, unfortunately, there may be some options that might be lower quality. But I would highly encourage you to be extremely choosy with who it is you decide to be your practitioner. Do not just choose somebody because they're cheap, and do not just choose somebody because they're local and in your area and nearby. If you're truly genuinely in a crisis, you need to have somebody who has the tools to appropriately help you. And
I came back before even getting a refill just to say, can I say one real quick, real quick?
Real quick.
So, just like a casual example, I see mostly liberal people who love to meme on pull yourself up by the bootstraps all the time. They say, just work out, bro. Just work out, bro. Just eat better, bro. Like they're fucking accomplishing something. But I mean, personally, the first thing my psychiatrist ever said to me was like, listen, we can do all the therapy and the meds that we want, but if you are not eating 3 decent meals a day, sleeping well, normal hours, and being like moving and being active more days than you are sedentary, you will
hey,
not get
Gibbs.
better. Point blank, period. No
Hey, Malcolm.
excuses. I don't care if you're depressed. I don't care if you feel bad. Go to the fucking gym. Take care of your body because
And
your brain
who
is an
told you
organ of your
that?
body. My psychiatrist.
Your therapist. Great.
No,
Awesome.
my medical doctor. My medical doctor. A psychiatrist is not a therapist,
Hmm.
Wick. Psychiatrists have gone to medical school, Wick.
Yeah, I want to agree with everything Allison has said. It is 100% this liberal bullshit ideology that has caused the problems with American
Gibbs.
society today. I mean, it is. Think of it. We have all these soft ass kids getting participation trophies, and now suicide through the roof. Back when people used to be winners and losers, and they knew their role in life, and they knew how to deal with loss. Guess what? Less killing, more whoopings. It was much better for society. Allison's 100% correct.
Okay.
No question.
Mongoose, please.
Yeah, I just wanted to say a couple of things. I have to jump here in just a minute, but I wanted to hop on. Something that I think is interesting is that like there is kind of this culture around pharmaceutical medicine, whether it's like you're going to the doctor because you have high blood pressure, or whether you're going to like a psychiatrist because you're feeling under the weather, you feel anxious, depressed, whatever it may be. That like the kind of the end of that conversation or that appointment is going to be you getting on some kind of medication, right? So if I go to the doctor for high blood pressure, they're going to give me medication for my blood pressure. My doctor is not my personal trainer. My doctor isn't going to follow me around all day and say, oh, don't eat those Dorito chips. Make sure you're eating an apple. Or, oh, you haven't got your steps today. Let's get up and move around your house. Psychiatrists and doctors that prescribe medication and treat like specific illnesses exist to fill a very specific gap. So when we're talking about therapeutic tools and going to therapy and the difference between psychiatrists and therapists and all these other kind of moving parts, physical health as well, it is 100% true factually that 100% of people would feel better than they do right now if every day they drank a decent amount of water, if they had a decent sleep schedule, and they got about 30 minutes of exercise a day, and they weren't up till 4 in the morning watching TikTok videos. That is 100% true. But within that, there are certain things that certain people just, one, don't know how to handle, or two, they have some kind of chemical imbalance or something else going on underneath that requires pharmaceutical intervention to help regulate those levels. That way they can build a better life with the assistance of those tools. And that's really what psychiatry and what psychology is as a whole. And the usefulness of therapy as opposed to going to church or to, talking to a trusted friend or a family member or a partner or something like that is that therapy, so like DBT, CBT, EDMR, all of these are going to give you a very specific set of tools that are going to be helpful for you to use in your life. And the fact is that the whole point of this is that we're building a giant toolbox. I'm going to get advice and support from my friends, my peers, my family, religious leaders in my community, my boss, my brother, my sister, my uncle, my cousin. I get all these tools, and then I'm going to get an additional set of tools from my therapist. This is how to deal with, here's like some DBT skills to cope with like stress or, emotional dysregulation or significant loss or a crisis. And then on top of that, if I have this big box of tools and I'm still like, fuck, I'm having a really hard time keeping my shit together, then we can escalate and say, okay, well, maybe there's something else going on. Maybe we need to manage these other symptoms with like pharmacology, and then we can reevaluate this toolbox later. And I think the problem is that when we talk about psychology and psychiatry as a whole, like we're not looking at the whole picture. We're looking at like individual parts and like picking out something and being like, I think this is dumb as fuck. I don't think this works. And it's like, well, yeah, if you just throw antidepressants at somebody, it's not going to do anything. This has to work compounding with other avenues of support and more tools in the toolbox. So I think it's just a reductive take to say like, well, I went for walks and I'm better. It's like, yeah, that might have worked for you, but somebody else might not have the toolbox that you have. They might not have the resources or the experience or the support system that you have. They might need those additional resources. So altogether, when we build this nice, beautiful, big toolbox, that's what we want to give to people. We don't want to sell like the individual experiences of just like, just talk about your feelings, you'll feel fine. Or just take a pill and you'll feel fine. Or, hey, just drink an extra glass of water a day and you'll feel great. The reality is that it's this big, 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 big picture, and zooming on the minutia is really unhelpful and really like unproductive.
I also want to add, I think that y'all talked about this some already, but it does seem a lot with, especially with TikTok and a lot of the mentality in today's world. You see a lot of this, like, I brought it up with the participation trophy mentality. It's like an enablement, right? People tend, especially on the left, they tend to make their whole identity whatever their mental illness is, and that's like they're special. Like, oh, I'm autistic. Oh, I'm ADHD. Look at me, I'm so special. I'm this weird thing. As opposed to used to, you would weed that out and then people would go actually get help and they would actually try to change. And now
Mm,
people want these things so that they could be this. And it's just a very bad, overall
mm.
unhealthy mentality across the board, in my opinion, that we've created. And it's the liberals' fault.
I don't know. I mean, I think that like it's I think that it's a little bit of that, again, based off of like the study that was mentioned earlier, but I don't think it's reducible to that. And I think that like and I would agree actually like with everything that like Malcolm just said, like regarding like, these are tools, and yes, those tools are different than like the what you go like as opposed to simply going to your religious leader or just going for walks, and no, and yes, that's reductive, and yes, some people might genuinely benefit from therapy. But if they're going to go to therapy, they need to go to a therapist that can actually give them the tool that they need, the appropriate tool, and who are effective and qualified at being able to provide them that tool. The issue that I have with like a lot of therapy that exists right now, and a lot of the products that are placed at people is that people are being at like okay, so the Enneagram person is an example. There are lots of people who call themselves therapists and who say that they are therapists and that they are providing, you know, good tools for people to use. And really what it means is you're going to sit on the couch to complain about your problems and you're being given like a weird pop psychology test as opposed to like being given like rigorous like CBT or rigorous DBT. And something else that like Schreier pointed out in her book, which I also think is true, there is a huge difference between going to a counselor or a therapist who is licensed in CBT and is going to have you like that type of therapy as opposed to a therapist who says they involve elements of CBT within their therapy. Those two things are not quite the same. And I think that like while it's true that like just going for walks every day isn't going to be the thing that resolves it, I think it's a heck of a lot better than sitting in your bedroom and worrying and obsessing about having a mental problem. Um, But I do disagree, Gibbs. I don't think it's just that the whoopings are gone. I don't think it's just because, we're just too soft, we're giving out participation problems. I think that the problem is much bigger than that. And I don't think it's just like, here's an example. This is a piece from the book that I also think is true. So they brought up the idea specifically for children going to therapy. I think that it's probably way more true today that a child. So and I obviously, like, teenagers are kids, but when I say child, I mean somebody under the age of 10. I mean like a 5-year-old. I think it is probably far more likely that somebody might bring their 5-year-old to individual therapy today as it would have been true in 1950 or 1960 or in the distant past. People are more likely to do that today. And that was something that was criticized in the book
Do you
as
have
being inappropriate.
like does it, and I haven't read the book obviously. Does it cite stats or is it just a feelings thing? Like, so
No,
does it cite the
they cite-
comparative stats between 5-year-olds who would go to therapy in the 80s versus 5-year-olds who go to therapy today?
It's
So
mostly a collection. There are studies like outright cited, but it is mostly a collection of interviews.
So
okay,
no.
so
it's an interview
No is
from a
the
child
answer.
psychologist.
it's
Yeah,
a
my
pop
question.
psychology book where she makes
No
an
is the
argument.
answer to my question when
But
I'm
let me-
asking
so-
if there are
Was
stats.
your question
right?
was if there were stats, and I said there are some stats and also interviews, and you're trying to say the
The
answer's no
stats that
right
I
now.
would
Please fucking
say,
explain,
the
Wick.
stats
Please
that
fucking
I would
explain how
say,
that is true.
if you would
Let me ask
listen,
you-
if you would listen, Allison, the stats I specifically asked for, whether they or not was there, was the rates of 5-year-olds or young children, I guess I would say, going to therapy in the 80s versus going therapy today. Are they, because Fair
they
Queen
can
mentioned
empirically
that she
demonstrate,
thinks that there would be more, and I asked her, is there
She's
actual
basing-
stats in this
she's-
book which
she's basing-
break
she's
this
basing-
out?
Yes.
she's
Really,
basing
really
this-
quickly. Sorry,
Yes.
I have to jump because I have to go and make dinner really quick. I just want to throw two things really quick. One, anything written by Abigail Schreier should go directly into the garbage can. She had the same issue when she wrote Irreversible Damage. 90% of what she cited in Irreversible Damage, if you go through and you look at every single source that's provided, it's either cited incorrectly or she read it wrong. So I have not read this book yet. I am planning on buying it and reading it, but I'm willing to bet good hard cash that it has the same issue that Irreversible Damage did, where it was just narrative driven, where it was like, I talked to somebody who worked in this field and this was their experience, and it's very loose on the data. It's very loose on the experiences of the people as well because they can't be externally verified. And just for preface, like, Irreversible Damage is about teenage girls like mutilating themselves and cutting off their tits, and every single like case study in the book was somebody who was like 20 years old and in college. So these are the young girls that are gutting themselves.
There's a
But quickly,
psychiatric cohort where the numbers are exploding.
Quickly,
It's empirically demonstrated.
quickly. Before I have to go and make dinner, Allison, be polite. It's Women's History Month. You better be fucking nice to me. Second of all, a really, really good book that I would recommend to everybody who's watching is called Insight. It's by 𝕬𝖎. And she is kind of like a lifestyle coach, and she talks a lot about the damaging aspects of psychotherapy and the way that, like, when we think about psychotherapy and we think about sitting down and just bitching and complaining and moaning about our problems, it creates a thought loop. And that's something that a lot of modern psychology is based on. And it advocates more of insight instead of introspection and self-reflection, because it gives like a motivated, like, this is the thing that is the true issue and this is why I need to change, and how to get out of those like thought terminating loops pretty much. And she worked very closely with the people that developed CBT and DBT in order to come together to write this book. Excellent book. 10 out of 10 would recommend it. Fuck Abigail Schreier. Allison, I still love you, even though you're dead fucking wrong. I love you. I'll see you guys later, okay?
Love you
Bye.
too.
Yeah, I mean, I want to say one thing.
To
Let me.
answer your question, they can empirically demonstrate that children under 10 are interacting with mental health professionals more than they were in the 80s. Yes, and that is cited in the book. Yes.
I don't know what is a 5-year-old need to go to therapy for. I mean, I'm a grown ass conservative man. I've been to therapy. I went to a psychiatrist, and they diagnosed me with OCD. One cool dude. But listen, that as all jokes aside, I got to be honest here. Like, what does a 5-year-old need therapy for? They're 5, bro. They're 5. Like, if you want to talk about like why we don't need as much therapy, or we need different kinds of therapy, and why the whoopings are good, go read the Junction Boys. These guys survived some brutal stuff through under like one of the best coaches of all time. Afterwards, they win a national title, or they win a big Southwest title. Like, it's amazing how people, when they're put through adversity, can learn things. And now people get one bit of adversity and they will.
So you know what? You know why, and this is just a guess, a hypothesis, where a child might need some therapy, is after listening to that dumbass take you just gave, I feel like I need therapy. If there's a 5-year-old in the room, right, who happens to listen to his dumbass mom or dad who's watching your show, they might need therapy, right? Maybe perhaps with the rise of social media and the access to dumbass takes like you just gave right there, right? There may be more need for kids or who have experienced the trauma of your dumbass takes to go to therapy to be cured. $2 from Testicle Justice to say 𝕾𝖍𝖎𝖙. Thank you for the $2. But with that said, please, other people, go ahead.
Well, so I was just going to complete the 5-year-old thing. I wasn't able to finish. So the
I feel
5-year-old.
thank you.
Well, so this is like what the book specifically states, like about
I
therapy for
didn't kick him.
5-year-olds.
So go on.
Well,
No, he said he
uh,
had to go.
Okay.
so what it says in the book is that, so suppose you bring a 5-year-old to therapy and you sit down and you have a therapist who plays blocks with the kid, asks the kid how they're feeling, maybe plays dolls to try to like with the kid in order to try to get them to discuss their emotional state, to try to reveal like what it is that they're really thinking or really feeling. Um, the problem is that, like, if you sit down with a 5-year-old and you explain to the 5-year-old about, like, what's wrong with them, here are some tools that you can use to try to make yourself happier, like, those kids do not remember that. They're so young that, like, many of the tools that, like, you would otherwise give in therapy to try to help them, like, to maintain their mental health or try to improve it, they are not developed enough or old enough to take responsibility yet for their mental health. They are not prepared psychologically or, like, developmentally in order to do that. So what the book recommends is, if you're concerned that your child is experiencing anxiety, it's much better for parents to go to therapy and to talk to the therapist and to receive advice from them, from a licensed therapist, from a licensed child psychologist, and then to try to employ those methods with their kids. But that's not what's happening. Oftentimes it's the case where instead parents are taking their children, their very young children, to go to therapy instead of them going to therapy, getting advice,
To
and then
unlicensed
choosing whether to.
therapists?
Hmm?
Because if there's a therapist who is licensed to deal with pediatric care and things like that, I don't know if that's wrong. Like, if they are licensed, credentialed, and are acting appropriately, if there's no problem, they will say there's no problem, right?
Well, that's
It's
hotly debated if they're like, if you're, for instance, allegedly a very popular form of therapy for children is play therapy, and allegedly there's not much evidence to suggest that it actually works, and that actually there's a lot more evidence to suggest that looking at the parents, seeing what maybe the parents could be doing to dysregulate their child, seeing what maybe the parents could do to like alter the environment of the child, that's actually a lot more efficacious. But allegedly it's a lot fucking easier to sit down with a 5-year-old and play blocks than it is to talk to an adult about how they might be fucking up their kid. So allegedly therapists are a lot more likely to do the first thing, even though maybe it's not as empirically supported.
Allegedly.
Allegedly.
Perhaps. Maybe. That's the implication.
I'm just a random person, guys. Look it up yourself. Don't take my word for it.
$2 from Cryborn. Gibbs dad joke. Got a kid he doesn't know about? I don't know. I'm not going to speculate on his offspring or lack thereof. Gang, it's been a pleasure. It's been something. Thank you for coming on this show, both of you. I will see at least Fairy Queen on Thursday. We're gonna rate out. Who we going to? I'll let Allison decide. Allison.
Wait, who are the
pick.
options?
Let me see. Let me look.
I actually have to go because I have to hop
I'll
on
see you later.
Gibbs's show, but I will see you soon. Thank you so much.
Bye, Fairy Queen.
Bye, everyone.
Bye. We could go to
Bye.
Gibbs. Do you
Go
want
to
to go
Gibbs.
Okay.
I vote
Gibbs.
Gibbs. Yes, thank you. Bye, guys. Thank you so much, Wick.
Bye.
Bye, Allison. Thank you.
Bye. Okay, I'll rate it out. Gang, remember, no stream tomorrow, but we're going to stream Thursday. Tune in. Gang, if you like the content, subscribe to my channel, join the Discord, yell at me later. Yeah, we'll see you later. Bye-bye.